Good morning, Council Chambers. Before we begin, I will go over the emergency response plan for this room. In an emergency, everyone must evacuate through the safest, nearest exit. Council takes direction from the meeting clerk to evacuate. After evacuating the room, please proceed to a stairwell. Take the stairs to ground level and evacuate the building through the doors marked emergency exit and go to a master point. Do not take an elevator or walk through the city room. Anyone with limited mobility should identify themselves to security or the meeting clerk during an evacuation. Finally, please speak with the security or the meeting clerk if you require first aid. Thank you.
Thank you. Good morning. I would like to call this meeting to order. And at this time, I would like to do a land acknowledgement. I would like to acknowledge that we meet on the traditional land of Treaty 6 territory and Métis homelands and acknowledge the diverse Indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as Cree, Dene, Saulteaux, Blackfoot, Nakota Sioux, as well as Métis and Inuit, and now settlers from around the world. Next, I'll do a roll call. I'll start with committee members. Councillor Rice?
Good morning.
Good morning. Councillor Knack?
Good morning.
Good morning. Councillor Paquette?
Good morning.
Good morning. And I'll just check to see if the mayor is online yet. Mayor Sohi? No, he is on city business, so he will be joining us when he is available. And I'll go through other council members. Councillor Wright?
Good morning.
Good morning. Councillor Stevenson? Councillor Tang? Councillor Hamilton? Councillor Rutherford?
Good morning, Councillor Prince Bay.
Good morning. Councillor Salvador?
Good morning.
Good morning. Councillor Cartmell? Councillor Jans?
Good morning.
Good morning. Okay, so next we will go, I'll ask one of my colleagues to move adoption of the agenda.
So moved.
Thank you. Any questions? Please vote.
Yes.
Thank you, Councillor Rice. We have all the votes.
Please display the vote. And that has carried. Next, approval of the minutes. Councillor Knack?
Yes, thank you, Councilor Prince Bay. I'll move the approval of the minutes from the February 5th, 2024 Community and Public Services Committee meeting.
Thank you. Are there any questions, errors, omissions? Seeing none, I'll ask you to please vote.
We are just resolving a technical hitch. We have all the vote.
Please display the vote. And that has carried. Next, protocol items. I am not aware of any protocol items this morning. On to selecting items for debate. Could I please ask my colleagues to sign up to select items for debate?
I'll select item 7. Oh, actually, you know what? I see now people are on the list. I'll be quiet.
Okay. Thank you, Councillor Paquette. Councillor Knack, please go ahead.
I was also having trouble clicking on, so to be fair, I finally got in. I'll select the items 7.1 and 7.2, please.
Thank you. All right, vote on items. Oh, Do we vote on items now, not selected for debate? Or do we?
We have just 2 items.
Okay, so the reports to be dealt with at a different meeting does not need to be? Okay,
No.
wonderful. Great, so next we're on to requests to speak. I'll move request to speak as I have the list here right in front of me of the speakers. So I would like to recommend that Community and Public Services Committee hear from the following speakers in panels when appropriate. For item 7.1, mental health and addiction within City of Edmonton, Jiri Pulgandla, Angela Ross, Jackie McGowan, Catherine Hay, Yusul Durak, Ali Altaf, and Sheila Stauffer. And on item 7.2, dog off-leash area establishment, Popup parks and community initiated options, Andrea Grunier and Kevin Matheson. And I'll ask my colleagues to please vote.
We have all the votes.
Please display the vote. And that has carried. Next, requests for specific time on agenda, none. We do have 7.1 as first item of business. Councillor inquiries, none. Reports to be dealt with at a different meeting. We have 4.1, mortality rates in Edmonton's homelessness population. Requests to reschedule reports, none. Unfinished business, none. We're on to our public reports, item 7.1. I would like to ask if administration has a presentation for us.
Good morning. This is Jennifer Flaman, Deputy City Manager for Community Services. We do have a presentation, and maybe I'll just make a few opening remarks that this presentation today is coming to you as a result of a request at the February 7th, 2023 Community and Public Services Committee meeting where the following motion was passed, that administration work with Alberta Health Services to provide a report on mental health and addiction issues within the city. And that is what we're here to do today. With that, I'll pass it over to Stacey Galatly. Is she online yet? If not, then maybe I will pass it over to our guest from Alberta Health Services.
Yes, that would be great. Thank you.
Great. Hi, Mark. If you wouldn't mind introducing yourself, and we'll get the slide deck up.
Thank you. Thank you for having me. My name is Mark Snattersey. I work with Alberta Health Services, and I'm the Executive Director for Addiction and Mental Health here in the Edmonton zone. So thank you for the introduction.
Sorry, Mark, to interrupt. We're having a little bit of a hard time hearing you. I'm not sure if you can move a little bit closer, maybe.
Is this better?
That's better. Yes, thank you.
Okay. Thank you for letting me know. I'll try to speak loud. Thank you for the introduction, and thank you to the committee for your interest in understanding the scope of addiction and mental health services that are offered by Alberta Health Services here in the Edmonton zone. First, I'd like to acknowledge the incredibly wonderful work that is being done in addiction and mental health by all of our community partners. When we think about the addiction and mental health services that are available in the Edmonton zone, AHS, or Alberta Health Services, is certainly not the only game in town, and we greatly value all of our community partners that, together with us, make up our system of care. Low barrier access to interventions such as health promotion, illness prevention, psychoeducation, virtual online supports, brief counseling, peer supports, or time-limited therapy are available from a large variety of community partners, including nonprofit agencies, primary care networks, municipalities, and employee assistance programs. Our role in Alberta Health Services is to provide the higher intensity and specialized addiction and mental health services and supports that are needed by people who have a more severe, complex, or chronic illness. We offer a broad range of services, including clinic-based services distributed across the city. We provide mobile outreach. We have crisis supports 24/7. We have assertive community outreach teams. We have day programs and day hospitals. We have bed-based community detox and residential addiction treatment programs. And of course, in our hospitals, we have acute hospital-based inpatient beds. We also provide some highly specialized programs for clients across all of Alberta. For instance, programs that offer services to people who have both an intellectual disability and a mental illness or substance use disorder. Complex clients with eating disorders and forensic psychiatry clients who have come to access our services through the criminal justice system. The services that we offer span all ages, including infant and preschool, school-age children, adolescents, young adults, and seniors. Today, our youngest client is 3 years old and our oldest client is 104. In 2023, over 62,000 unique individuals accessed our addiction and mental health services in the Edmonton zone, and a little over 20% of them came to us from outside our zone, mostly from Northern Alberta and Central Alberta. We play a very large supportive role for rural Albertans. Our key system improvement focus over the past decade has been to simplify system navigation by creating centralized points of entry, such as Access 24/7, where people can come, they can be assessed, and they can be directed or scheduled directly with the health service provider or team that can most appropriately meet their needs. Excuse me. Instead of patients and families trying to navigate their way through our complex system to the most appropriate caregiver, people can access everything we have to offer from one convenient front door. By improving system navigation, we are beginning to better understand and quantify the large unmet need that exists for addiction and mental health services. We're always working to improve system capacity, access to services, and improve our wait times for our services. I've provided in your agenda some pictographs and statistics in our report that describe the range of services that we provide, the volumes of people that are served, and I can expound and answer any questions pertaining to those during the question period. I just want to finish by talking a little bit about the restructuring that is currently occurring in healthcare in Alberta. As you are aware, Alberta Health Services is being deconstructed into 4 separate provincial organizations. The first of these organizations will be mental health and addictions, and we are expecting to be operational this spring or early summer. The other 3 organizations will be specific to acute care, continuing care, and primary care, and they will be operational a little bit later in 2024. Our new provincial mental health and addictions organization will report upwards to our Ministry of Mental Health and Addictions, while the other 3 organizations that are being created will continue to report up through the Ministry of Health. I want to assure everybody on the committee and everybody in the Edmonton zone that the reorganization that's taking place will not negatively impact the spectrum of addiction and mental health services that we provide in the Edmonton zone. We're going to continue to offer our services in a manner that is coordinated and integrated with the rest of the healthcare system, and we will continue to work with all of our partners in the community to best meet the needs of people who live within the Edmonton zone. Thank you.
And thank you. Is that the conclusion of the remarks from administration?
Yes, it is.
Okay, wonderful. Thank you very much. We will go now to hear from our speakers. I would like to let you know that speakers will be heard in panels, and each speaker will have 5 minutes to present. The clerk will run the official timer in council chamber. The lights will start green for the first 4 minutes, turn yellow for the when there's 1 minute remaining, and then flash red when 5 minutes are up. If you're participating virtually, which everyone is today, you may wish to use a timer of your own to keep track. When everyone in your panel has had a chance to present, members of council may ask questions of you or other panel members. For this reason, you may wish to remain in the meeting until all questions have been asked of your panel. If you're participating virtually, please remember to mute your microphone when you're not speaking and refrain from using the raise hand function, as it creates issues of fairness and decorum. If you're experiencing any technical difficulties, please reach out to the Office of the City Clerk using the contact information provided in your confirmation of registration or at city.clerk@edmonton.ca. So we will go to our first speaker, Jiri Puliglanda. Please, go ahead. You have 5 minutes.
Thank you. I submitted a presentation on Friday. Oh yeah, perfect. Okay, good. Thank you. Okay. Thank you. My name is Giri Puligandla. I'm Executive Director of the Canadian Mental Health Association Edmonton Region. I appreciate this opportunity to speak to the Community and Public Services Committee today regarding mental health and addiction issues in Edmonton. Also want to thank Mark for starting us off today. CMHA Edmonton Region is part of the CMHA national movement that promotes the mental health of all and supports the resilience and recovery of people and families. Sorry, can you just move to the next slide, please? Okay, thanks. CMHA Edmonton Region is part of the CMHA national movement that promotes the mental health of all and supports the resilience and recovery of people and families experiencing mental health challenges in 330 communities across Canada. CMHA's history in Edmonton goes back 70 years and in Canada over a century. Next slide, please. For decades, statistics related to mental health have been consistent over time and across jurisdictions. The main things to pay attention to here are that while many people experience mental health issues, few seek help and even fewer get the help they need. In the end, only 5% have long-term intensive psychiatric needs. Next slide, please. It's important to understand that mental health has interdependency with many other personal and social issues. Action on family violence, social disorder, addiction, suicide, or supporting people with disabilities or trauma impacts necessarily requires reliable access to mental health supports. Next slide, please. Unfortunately, this is not the norm. The stories of confusion, frustration, and desperation I hear from individuals and families today are nearly the same as those I heard when I started on my career path at the Schizophrenia Society almost 25 years ago. Probably the same stories that Mark continually hears as well. Thousands and thousands of families have experienced mental health challenges for so many decades, and we haven't moved the needle to change people's experiences for the better. Next slide, please. Part of the reason could be our overemphasis on medical or clinical care, those within the domain of the formal health system. This encompasses the top two levels of this triangle model for addiction mental health services, which Mark spoke to. The bottom three tiers are larger to represent bigger proportions of the population that require them relative to the higher tiers. Nonetheless, while we have structured, systematic investments through AHS in inpatient, outpatient, community-based clinical care, primarily oriented toward the 5% of the population that have severe mental illness, the bottom three layers are disorganized and patchy at best, absent and neglected at worst. But let's consider this. Research consistently shows that for people dealing with severe mental illness, the variables that are the biggest predictors of recovery and wellness are 1, strong family support, and 2, positive social network, so supportive friends and coworkers, regardless of treatment modality or diagnosis. So why are we ignoring resources at the family and community level when they are at least as important as clinical services? Next slide, please. This is why CMHA is turning the focus to community mental health. For years, we have alluded to it by recognizing its absence, like lack of support after discharge from hospital, lack of involvement of family caregivers, gaps in social supports, cultural or linguistic barriers, or burden on police and emergency services in responding to mental health crisis. Instead, when we start to describe a system of care and community, we discover the obvious pieces that have been missing from the puzzle. Things like addressing social determinants, increasing knowledge within families and social networks, integrating primary care and cultural supports, elevating peer support, as an automatic response to support people through medical care and system access, and enabling a comprehensive purpose-built mental health and suicide crisis response pathway. Next slide. The solution to growing addiction and mental health concerns is to ensure investment in a comprehensive, predictable, and reliable system of care at the community level that focuses on simplifying people's journeys and ensures early access and dependable continuity across services. Next slide, please. Since late 2022, CMHA Edmonton has been working in partnership with the City of Edmonton and the United Way of the Alberta Capital Region to develop a strategy for community mental health, along with a governance structure that has people with lived experience at the center of direction setting and decision making about the system of community mental health care that we need to co-create. We're excited to share the outcome of this work later this year. Next slide. The effort is not focused on high risk or vulnerable populations. Literally everyone knows someone who is struggling with mental health issues if they're not dealing with it themselves. The point here is that this is really an everyone everywhere problem that requires an everyone everywhere mindset for solutions. Next slide, please. To get a glimpse of what we're working towards, imagine this. If anyone in that room clutched their chest and fell to the ground, almost everyone would know what to do, chest compressions, who to call 911, and what comes next, cardiac care. On the other hand, if someone were to say they're suicidal or struggling with mental health or substance use, very few would know what to do, who to call, or what comes next. A better future is one where mental health responses are predictable and familiar to us as they are for other health issues. Next slide, please. So in terms of who to call, fortunately, CMHA operates 3 lines: 988 for suicide crisis, 211 for finding services, and distress line for a variety of crisis and emotional support. Call any of them and we'll help you get to the right help. Next slide, please.
Sorry, I'm sorry.
I'm good.
Actually, up, but we do have the presentation, and we'll be sure. I'm sure someone will be asking you some questions. So thank you very much.
Thank you.
Next, we'll move on to Angela Ross. Angela, please go ahead. You have 5 minutes. Angela, I can see you're online, but we can't hear you yet. Are you there?
I'm muted. I'm sorry.
That's okay. Go ahead.
Good morning, everyone. My name is Angela Ross. I'm the ED of Momentum Counseling, and I'm the chair of the Edmonton Counseling Community of Practice. Next slide, please. Thank you for the opportunity to speak. Before I begin, I wish to acknowledge the land, Treaty 6 territory, and Métis Region 4, and respect for the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. Next slide, please. So who we are. Collectively, we are agencies that provide community-based mental health care in Edmonton and area. We offer quality mental health care with an emphasis on wait times and preventative and/or specialized treatment. The majority of us are not-for-profit registered charities. Many of us are also teaching institutions for graduate level counseling interns. Our community of practice includes the following agencies: Momentum Counseling, YWCA Edmonton, CSS Mercy Counseling, Jewish Family Services, the Family Center, the Mustard Seed, Boyle Street Community Services, SACE, Islamic Family, Mennonite Center for Newcomers, the Hoarding Disorder Foundation of Alberta, United Cultures of Canada Association, Rise Up Society, Cornerstone Counseling, Aboriginal Counseling, the Africa Center, Kiev, E4C, and the BIPOC Healing Center. Next slide, please. We serve vulnerable populations, including newcomers, 2S LGBTQIA+, Indigenous, those with housing vulnerabilities, and those impacted by the social determinants of health. In many cases, we are often the third or fourth resource Edmontonians reach out to for help. Most begin with services provided by AHS, and when clients present to us, they are often in significant distress and require more intensive support than our programs offer. This trend has increased significantly since 2020. Acuity is higher, and the opportunity for prevention or early intervention is lost. Interpersonal violence, substance use, and suicidality are all on the rise. Next slide, please. The mental health care services and supports we collectively provide take immense pressure off the already taxed public system. The value proposition of our service delivery model is incomparable to the public system, saving significant taxpayer dollars. Accessible and affordable community-based mental health services reduce hospitalizations, and can meaningfully mitigate issues of substance misuse, interpersonal violence, as well as contribute to safety, community safety and well-being. Our clients come to us particularly when they are unable to access support through the publicly funded system in a timely manner. There is a dearth of mental health professionals in Alberta. Many private practices have wait lists, and the AHS Edmonton zone has vacancies. Given the high earning potential of therapists in private practice, last year, the PAA raised the rate of registered therapists to $220 per hour, some of the highest rates in the country. Next slide, please. What we need. So with the significant increase in need due to post-pandemic recovery, inflation, and the cost of living pressures Edmontonians face, the majority of us are facing immense funding pressures. Our fundraising efforts have been negatively impacted. Many of us have lost operational funding. Funding is often short-term, negatively impacting recruitment and retention efforts of highly qualified therapists. Their earning potential is high, and we cannot compete with the private or public sector. We need support from the provincial government. The majority of us do not receive any funding from the GOA. We need access to data. We need less onerous reporting requirements. We need non-clinical program staff to ensure we can fully support our clients and therapists. It is very difficult to scale up to meet demand with limited resources and limited funding for accommodation and technology. Next slide, please. I hope this has been helpful to demonstrate the importance of community-based agencies in our city. Thanks for the opportunity to speak.
And thank you. Next, we'll go to Jackie McGowan. Please go ahead. You have 5 minutes.
Hi, it's myself and Catherine Hay presenting right now with the Kickstand piece. So Catherine, I'll turn it to you first.
Perfect, thank you. Hi, everybody. My name is Catherine Hay. I'm the Executive Director at Kickstand, and I'm here with Jackie McGowan, the Vice President of Community for the YMCA. I'd like to respectfully acknowledge our place of live, work, and play is on Treaty 6 territory, the traditional gathering place and traveling route for the Métis Nations, Cree, Nakota Sioux, Dene, Saulteaux, and many other Indigenous peoples. As Kickstand works to establish integrated youth services within our Alberta communities, we strive to maintain a commitment to listening, learning, and approaching implementation with a focus on equity, inclusion, and decolonization. Next slide, please. We are excited to share a key advancement to the mental health and addiction services for young people and parents and caregivers of young people within the city of Edmonton. The first urban Kickstand center will be opening in the summer of 2024. This center will provide young people aged 11 to 25 with a youth-friendly, accessible one-stop shop where they can access integrated, holistic health and wellness services. Next slide, please. Kickstand Edmonton will provide a continuum of evidence-based services within 6 core service streams. These will include mental health services, substance use supports, primary care, including routine physical health care and sexual health care, peer support services, Indigenous wellness services, and a variety of social services that will include employment and housing supports and opportunities for young people to build life skills. The key expectation of the centers are that young people will have positive help-seeking experience, will be more quickly connected to services and supports, and will have all of their needs met in a coordinated manner in one location. Next slide, please.
The YMCA is the lead agency for the exploration, development, and operations.
Sorry, are you each have 5 minutes, so just wondering if you're planning on...
We just need the
okay
together piece, yeah.
Okay, then.
So sorry, the YMCA is the lead agency for exploration, development, operations, and ongoing enhancements for Kickstand Edmonton Centre, and will continue to work in close collaboration with Kickstand as well as other Kickstand centres across the province to create a strong and sustainable and impactful network. Next slide, please. As the lead agency, the YMCA was awarded the project development contract with Kickstand to bring together key stakeholders, including young people, over multiple meetings and collaborative sessions during the last 8 months. They have worked together to establish a shared vision and increase awareness for the project, assisting with fundraising and establishment of a physical location of the center. Next slide.
Thanks, Jackie. So Kickstand receives funding from the government through active fundraising and key philanthropic partners, locally, provincially, and nationally. We also look for research and evaluation funding.
Apologies, point of order, Madam
Yes,
Chair.
I'm sorry, this is not the proper procedure, and this is why I had intercepted earlier. The proper procedure is you each have a 5-minute turn. There is no back and forth. So Catherine, we'll let you finish yours. And yeah, we'll just try to follow procedure here, please.
And last, Madam Chair, I'm hoping there's a point to this, as this is not an advertising venue. Thank you.
Okay, continue on.
Sure, next slide, please. We're not doing this work alone in implementing the Kickstand Edmonton Center, which will be a key component of a community mental health initiative within the city. We have connections to a number of other jurisdictions across Canada who are also doing this work. And next slide, please. And that's everything. Thank you very much for giving us the opportunity to talk about the upcoming service delivery within the city. And if anyone has any questions, we look forward to that. Thank you.
Okay, thank you. And next we'll go to Yusel Durak. Please go ahead. You have 5 minutes.
Thank you very much. Thank you all and good morning. And I would like to be very brief. I am Yücel Durak, registered psychotherapist specialized in addiction and mental health. I am with the organization. It's called Islamic Family and Social Services. I am the lead with prison and correction and focus too. So as social service organization, we strive to bring down the barriers that newcomers and refugees have in the front of them. And we offer cultural competent services. As we are Muslims, we service all over the community. What we see is the ethnocultural community has a big issue that most of the people, incarcerated people in the prisons, have addiction issues. So we would like to bring down that barriers. That's why we are visiting prisons, visiting halfway houses and doing dinner gatherings together with them and talk about mental health and addictions. So cultural competent counseling and cultural appropriate service is very much important for those people. And untreated mental health and addictions are alarming in our society. As mentioned earlier, the ratio is very big, and every day and every time the addiction issue is rising up. So among incarcerated people, ethnocultural group is having a big portion. So talking to them, giving service to them, and helping them and supporting them is very much important. And as Islamic Family and Social Services, we are requesting from city to give more importance to addiction and increased budgets to use this field. And also we need the collaborative support with city and Alberta Health. So thank you very much.
And thank you. Next, I'll see if Ali Altaf is there. Are you online? Okay, so not right now. Next, we'll go to Sheila Stauffer. Please go ahead. You have 5 minutes.
Well, thank you very much for allowing me to speak today. I would like to say good morning to everyone. I'm Sheila Stauffer, the Executive Director of Cornerstone Counseling, a not-for-profit psychological organization with a mission to ensure that professional mental health services are available to everyone, regardless of their income. We accomplish this by setting our fees according to the client's household income, and most of our clients would not be able to access counseling without a fee subsidy. Our clients include the unemployed, the underemployed, those on AISH or disability, newcomers, students, Indigenous people, members of the two-spirited LGBTQIA+ population, and seniors. We have been working in the Edmonton area for 46 years, and last year we provided 12,000 hours of counseling to 2,600 people, not including our group programs and assessment work. We see clients as young as 4 years old, and our oldest client has been in their 90s. The majority of our clients are between the ages of 20 and 35. I would like to share some trends and gaps we are seeing in mental health care in Edmonton. Firstly, over the past 2 years, we are seeing more clients who are in unstable housing, suffering from severe mental health issues, and struggling with addictions. Our clients struggle with poverty and would benefit from other community services that we do not provide. This puts us in a difficult position of trying to help our clients with therapy while knowing these same clients are struggling to address their most basic physical needs. Secondly, our therapists are reporting feelings of burnout. Our organization has seen a 40% increase in service provision since the COVID-19 pandemic, and our therapists have been running on adrenaline for too long. A few months ago, a key staff member gave her notice to me, citing that her reason for leaving was feelings of overwhelm and frustration over insufficient resources to meet her clients' needs. I would also like to add that many low-income clients have complex needs, as they are frequently living in poverty and may have experienced multiple traumas, losses, and injustices. Along with therapists' reports of burnout, we are also finding it more difficult to recruit new therapists. With the surge of people requesting private mental health services, it is becoming increasingly difficult to recruit therapists, particularly registered psychologists. Private practice is lucrative, and as a not-for-profit that offers services at below cost, we are having difficulty offering comparable salaries. We have also found it nearly impossible to recruit experienced psychologists to offer supervision and training to our new therapists. Lastly, I would like to talk about funding. Like everyone else, we have seen increases in costs, particularly in operations and clinical staffing costs. However, many of our funding sources have plateaued or even decreased funding as grants have decreased or disappeared, and donors are also feeling the effects of inflation. Further, because Cornerstone has increased our services to accommodate the growing need during this difficult time, we are now too large to be eligible for some grants. We are currently almost at capacity at our current location, but the requests for counseling are continuing to grow. We would like to expand to better meet needs, but we are hesitant to do so in the current economic climate. As a not-for-profit organization working in mental health, Cornerstone wants to be part of the solution to Edmonton's mental health crisis. Like many of my colleagues here today, we have dedicated, well-trained staff, welcoming spaces, and proven track records of delivering evidence-based interventions that change lives. I'm very encouraged with this committee's focus on mental health and addictions, and I'm hoping that the city's and AHS's future plans include funding for not-for-profits who work alongside government and community agencies to deliver needed mental health services to people in the Edmonton area. Once again, I thank you for the opportunity to address the committee.
And thank you. I will call again for Ali Altaf.
We understand the speaker has declined to speak.
Okay, thank you very much for letting us know. So we have heard from all our speakers for item 7.1. Councillor Knack, you selected this item. Do you have any questions?
Yes, actually. Sorry, thank you. I guess I should click on there. There we are. Yeah, I thanks everyone for speaking today. I think really I just wanted to ask maybe of our first two speakers. Um, Wanted to get a better sense. I know there was some conversation. I think it was particularly you, Ms. Ross. Maybe I missed it. I think I got captured from yourself around that stability of funding from Alberta Health Services, as well as the data and access to that information. I guess I wanted to just get a sense, and I was going to ask our guests from HS around how funding has shifted over the years to, I appreciate that mental health is primarily under the provincial side of things, and unfortunately we are not, from a municipal perspective, rolling in money at this point. So I would just want to learn, like, what are you seeing? How has that funding changed, if at all? Have you received funding in the past and now it's not there, or what's that world look like for you?
Well, I can speak on behalf of Alberta Health Services.
I'll come. Sorry, I realize because you're part of the delegation, I have to come and ask you after questions of the speakers. So, just going to ask Ms. Ross and then our guest as well. So.
Thank you for that question. Alberta Health Services has been a wonderful support to us in basically funding operational costs and helping us to provide that accessible sliding fee scale that we do. I believe 2 years ago was the first time AHS was able to fund Momentum. I can't speak for my colleagues in the community of practice. We have pretty much never been funded provincially because, well, other than the odd program or group, despite multiple attempts to receive funding, especially now with the new emphasis on a ministry for mental health and addictions, it's quite frustrating, to be honest, despite a lot of advocacy coming from our group in particular. And the City of Edmonton has been a wonderful support to us, funding some of our most successful support groups and including us in the conversations around community-based mental health care. So yeah, funding, I could say collectively, for all of my colleagues in this community of practice has been our most significant challenge and barrier to scaling up and meeting the needs of the community currently.
Okay, thank you. And from the CMHA perspective, Gary, do you have any? Just wanted to get your take on that as well.
Yeah, AHS has been a key funder for some critical programs like Distress Line, Suicide Grief Support, as well as our Prosper Place community center. But it's hard to really talk about the past, right? And when we have this, as Mark mentioned, this kind of future that's unfolding, like literally in a couple months. So I express some optimism because we've needed transformation probably for 50 years, 40 years, 30 years. So is this our opportunity? I believe so. And I think, Angela, this is our opportunity to actually start to build that system of care and community. That's great. No, I'm glad to hear you have that optimism. That's part of it. Okay, I think those are all my questions for the speakers. Thank you, Madam Chair.
Thank you, Councillor Knack. Councillor Rice, please go ahead.
Thank you, Chairperson. I want to take this time to thank every speaker and come to talk about this important topic for our community. And then, Gary, I really like your presentation. So I'm going to follow up Councillor Lack's question. Yes, we understand mental health is under the authority of our province. And so I just want to ask one maybe a little bit deeper question. Based on needs assessment and all the community or service providers you have been doing, and also look at the funding model and right now, and what do you see that gap there? So I like you talk about looking for future. So, but for the future, how we align that needs assessment, what it needs, and the funding gap. And do you have any thoughts, or anybody welcome to jump in after Gary? Thank you.
Thanks, Councillor Rice. I mean, like I said, it's mostly gaps, frankly, on the community side. And there's actually nothing to laugh about when people are dying and suffering, but it is the reality of what we've been dealing with. I'd say certainly counseling being in this sort of private sphere, and then, you know, some people have benefits, some don't, and then, you know, and then also, I mean, I think that's a big part of it. I think child and youth services and the lack of integration is a big part of it, which is why I'm glad to hear from Kickstand today. We're supportive of that work. I think beyond that, really, I think about, you know, our friends from Islamic family. I mean, we benefited, frankly, from stigma in non-Western cultures for so many years. And now everyone's waking up to the impacts of mental health, and then they're reaching out for help. And there aren't culturally or linguistically appropriate services. So I think in terms of big gaps, that is a huge gap. That is a huge gap. We've known this for the Indigenous community for a long time, but certainly in every other community that's looking for, you know, Punjabi speaking or you know something that connects with people's culture. I think that those are just, I guess, 3 of probably 20 huge gaps at the community level.
Okay, so specifically, you mentioned a few points here: multicultural and the culture impacts on the mental health, and then with a different background. Also, you mentioned about intervention here. So what I'm looking for, I know everyone speak here, you have the first-hand experience and your work frontline. And then from policy review perspective, I want to looking for, is there any solution here, how we fill those gaps? And from future thinking, so not, like you said, not look at past,
right,
back. And specifically from today's presentation from AHA's provided, there actually I was very impressed by the number they provide, and from service perspective, but from community perspective, it seems you still feel the gap there. So I just want to understand better and how we fill that gap. And because any funding model or program supporting and specific supporting is based on the policy. So what policy we need here? And we need looking as policymaker, as the city leader here, we have to look into that. So that is my question. So I said maybe it's a bigger question, but I really want to get a sense this is great opportunity, and then all the service provider, or not all, some of service provider here, and you did a great job and in the community. And so I want to get a sense from you.
Well, I think fundamentally, and thanks for clarifying that. Fundamentally, as you said, you know, province has you know, jurisdiction is a funny word, because actually all orders of government and community need to be working collaboratively, right, to address mental health and related issues. The province has the biggest piece of this right now, and will into the near future. And I think what I can only wish for is that maybe we can set aside politics for a bit. And I don't mean to get into this, but the federal government, provincial government, municipal government, all working in tandem and collaboratively in some action at the provincial level, and then also supporting municipal and community stakeholders to kind of achieve this better future that I've been talking about.
Okay, yeah, thank you very much. And I will return to you, Chairperson Fay.
Thank you, Councillor Rice. Mayor Sohi, please go ahead.
Yeah, thank you so much, everyone for joining. I missed part of the presentation earlier on. So Gary, I want to start with you. You were mentioning to Councillor Knack in your remarks about the hope that you're seeing. Can you speak to that?
You know, I sure. I think that one of the main, and this is partly opinion, partly sort of, you know, my some of my experience. Part of the reason why we have this disorganized, you know, set of services and supports and lack of continuity and difficult access is because of how these services have been funded in the past. and lack of clear roles. And so, and AHS, doing its best, but as Mark said right off the bat, their focus is on the higher intensity, more severe needs, tier 4, tier 5. That's where they belong. But then everything underneath that, AHS was also the main conduit for funding. And then every couple of years, usually around election or in tandem with elections, the provincial government announces some new strategy, some new funding, and then we have a new patchwork, right? So it's just the lack of a systematic investment in a pathway, in a system of supports in community. So that's where I think that sort of this kind of reset that we're seeing kind of on the horizon is I don't know. I'm optimistic because on one hand,
is that going to change? Like, is there?
I believe so, and it's more than belief. Through our provincial Alberta division, we're working closely. We're working closely with the ministry, and there's a lot more attention on the community side. Understanding that that's really where the gap has been for decades.
Okay, well that's great. Maybe we'll follow with questions to folks from the AHS who are part of the city's delegation. Maybe to Angela, you said you're getting some support from the city. Can you elaborate on that? Like, what kind of support, and is it financial support, and which program is it from?
Currently, you're funding through the Living Hope program, which I read is currently being considered for some of the tax reduction. I implore you. We have an Anchor Men's group that is run now for 10 years that is saving lives. And we were able to double our offerings this past fiscal year. We have 4 hours, 2 groups a week, running for 51 weeks out of the year. And we had to move because of affordability issues at our clinic, and we've already outgrown our space. So we're looking for, because we have so many men coming, we're looking for alternative space. Another area where the city stepped in, we lost, for example, Momentum Counseling lost our FCSS funding in the last RFP, and the city of Edmonton stepped forward and covered us for 1 year, which kept us operational through 2023. If we wouldn't have had that support, we would have shut our doors.
Okay, so Living Hope and that interim funding help continue to provide the services that you're 100% providing.
Yes.
Yep.
So thank you very, very much.
We'd love to get your perspective, maybe if you could send us more information on. I think you shared some of the information, because I think it's very important as council making those very tough, difficult decisions that we would have to make as for budget constraints, that we hear from community organizations and the potential impact of those reductions that could have on your operations and the operations of your partner organizations as well. Okay. Good. Thank you so much. And thank you so much. Really appreciate all the work that you're doing.
Thank you so much, Mayor Sohi.
Thank you. Next, we'll go to Councillor Paquette. Please go ahead.
Oh, thank you very much. And thank you to all our presenters who came, and also some apologies for Angela and team. I may have, in my brief remarks, sounded harsh, but I didn't intend that. I am grateful to hear you expanding on the need in the community. And I am also grateful that you presented your services, but what we're hearing from you now is precisely what is needed in this conversation. So I was wondering if you could expand on some of the challenges that you were having in providing services and the gaps that you see in the ecosystem right now that is causing some of the problems that we see.
Absolutely. What we're seeing right now is this, and I think as Gary mentioned, this has been going on for many decades, but this lack of sustainable funding in the community-based sector. And so we're all running around doing 50-50 draws and going to Oilers games and raffles. And I have a hard time with that because I feel that we're providing an essential service that should be subsidized by the provincial government as their responsibility to provide mental health care to Albertans. And so the city is stepping in to assist through the community safety and well-being structures, other agencies, other corporations are stepping in to assist. But until there's a policy, as Gary mentioned, around how do we support community-based mental health care in Edmonton and Alberta, we're all going to be struggling and looking for funding every fourth quarter to see if we can continue our operations. And as Sheila mentioned, that makes it very difficult for us to recruit and retain the clinical talent that we require to manage the level of acuity that we're seeing post-pandemic. And AHS, their mandate is that level 4, level 5. And right now, the prevention, early intervention, levels 1, 2, and 3 is under assault by the provincial government in the sense of their policies around recovery-focused treatment, not harm reduction, not early intervention or prevention. So when we're applying for funding, it becomes very difficult to meet their mandates because they're clearly only focused right now on a recovery methodology, which the majority of us don't meet that criteria.
Right. So this is where I'm having trouble connecting the dots between this stated recovery model and the way that people actually recover. And I'm just wondering, isn't this this is where I get confused. If the province is focused on recovery, doesn't that by nature sort of assume that we're going to have all of these necessary steps on the road to recovery? And some of it sometimes requires a little bit of a withdrawal mechanism that takes time, which means that people don't go cold turkey, for example. So
I couldn't agree more.
Is this not going to be a whole suite of efforts? Or when we say recovery, because this is what I don't understand from the province, so they just mean cold turkey?
And I'm with you in not understanding that. It's when you remove safe consumption sites, when you remove that harm reduction focus, people are dying. And community-based agencies are out there handing out naloxone kits, making sure people have clean needles, all of those kinds of things. And that money is not coming from the provincial government. That's coming from their own fundraising activities in their community-based agency. And for us as a prevention, early intervention kind of, treatment focus, we're not meeting the criteria for the funding grants that are coming out provincially because all the focus is on recovery centers, treatment, inpatient treatment, not looking at what's happening in the community to prevent people from becoming addicted in the first place. So it's becoming a huge concern for the majority of us that are offering these services.
Okay, that sounds really inefficient. Crowdfunding is essentially what taxes are. Mm-hmm. Should we be relying on ad hoc crowdfunding to fund life-saving efforts? Mm-hmm. I think I'm out of time. Okay, thank you.
Councillor Jans, please go ahead.
Thank you. I think Councillor Paquette makes some really good, Councillor Paquette asked some really important rhetorical questions there that I think are worth unpacking further. Similarly,
sorry, they were sincere questions. Thank you, Madam Chair.
Oh yeah, sorry. What I was trying to say is you can't comment in questions. So I was like, they're not comments, they're questions. Yeah. Regardless, thank you. I'm curious in understanding from our partners here with so what I hear from some of the agencies in the White Ave area is that the majority of unhoused youth or the youth with the most acute needs are sexual orientation and gender identity minority youth. I also note that there's been a tone from our premier lately that has been widely panned as unwelcoming. And I guess I'm wondering what has already, prior to, it might be too soon, but how are we expecting impacts or changes in our school systems, which previously have been safe, caring, welcoming environments? How are we expecting that to sort of spill over into the municipality, and what kind of are we going to be sort of anticipating additional levels or changes of support or need in the community? I don't know if Momentum or Kickstand or Cornerstone or anybody wants to take a crack at that, or Gary.
I've been doing a lot of talking, but we serve, 43% of the clients that we serve are between the ages of 12 and 28. And the 2S LGBTQIA plus community is growing in terms of looking for those supports. What's happening now with these potential policies is going to, we're terrified of what these policies are going to do to these youth that are already marginalized, that are already having difficulties finding services that are appropriate for their needs, and is going to have devastating impacts on these youth that are already at very high risk of suicidality.
Yeah. I had a question for Kickstand. Have you picked a site? Do you have a location of your facility yet?
We are very close to selecting a site in the West End. And I think, to echo Angela and much of what Gary has talked about today, we definitely feel that the possibility of creating those safe spaces and those social networks, and including families in services, and providing somewhere where young people feel that they're able to go, because I think one of their key safe places is going to be at risk now. So that I think that we're really hoping that the Kickstand Center will start to provide some of that integrated care, that one place that they can go and access a number of different services and feel a sense of safety and belonging.
And I was wondering if any of you have data around how many youth you refer to the emergency room or to the AHS system from your programs.
I don't have that, unfortunately. I wish I had the capacity, but as I mentioned in my presentation, data is very difficult to find, and it's very difficult to share within community-based agencies towards AHS and vice versa.
Yeah. Gary, you had your hand up?
Yeah, sorry, I would like to interrupt. Please put your hand down. Recommend, please do not put your hand up. Thank you.
Okay, yeah, sorry. Gary, yeah, sorry, same question.
So thank you. I'm learning a lot about the protocol. So we have data within our 211 database, within our 211 system and our distress line system. I mean, if only we had funding to analyze that and have to have data analysis capacity within our organization. At the same time, we are able to, we're willing to share that data and to have a better sense. But it's AHS is where people need to go for treatment and for all sorts of services. So of course, most people who kind of hit the threshold, they get referred to AHS because that's the services.
Yeah, thank you very much.
Thank you. Next, we'll go to Councillor Stevenson. Please go ahead.
Hi, good morning. Thanks very much to all of our speakers, not only for your presentations today, but for the really exceptional work that you do in our community. I wanted to start maybe just with a quick question to Sheila. I really appreciate you highlighting some of the trends and gaps that you're seeing. You mentioned sort of the rise in housing precarity and poverty that people are experiencing. And I appreciate this is probably a bit of a chicken and egg question, but is there Is there a causality there that, again, poverty, housing precarity is worsening or exacerbating existing mental health challenges?
Well, I would certainly say yes. Like if you think about, for example, a single mother who's barely getting by, she's got a couple of kids in school, and now she's looking at these huge increases in her gas bill, in her rent, in her food bill. So whereas before she thought, yeah, I can do this, I'm feeling successful. Now she's feeling like a failure, and her anxiety is through the roof. And we are seeing so much anxiety in people right now where they're just not sure what their future holds. So, that's just one example. So certainly I would say that the increase in poverty is exacerbating mental health issues in many people.
Okay, thank you so much. That's helpful. Then you mentioned also just sort of, the challenge of working with clients who you aren't necessarily able to solve or support some of their underlying conditions like housing precarity or poverty. Are you, and again, I ask this recognizing that this type of work, takes a lot of effort. But do you have sort of a referral network with some of the other social service agencies in the city? Or again, is that, I assume that's just sort of, additional work on top of your therapist's caseload that they may not have the capacity for?
That is exactly what we're finding. We've done some research, and we are actually have a student committed to doing some additional work finding resources, because my counselors have been using their own private time, lunch hours, etc., to look for resources to help clients, or they're coming to me or to other people like, who do you know? We have meetings, and that goes on quite a bit. I have this client who is so having trouble. They haven't filed taxes for 5 years, and they're not able to get any of their benefits that they would. And so they're saying, who do you know who will help with taxes? And so we discuss that, and we give a few resources. So it is very kind of word of mouth here. It would be nice to have a little better conduit for that.
Yeah, well, thank you. I mean, I think that highlights, a really critical role, sort of that convening role that I think the city is well placed to do, given that we do have a lot of connections with those agencies. And recognizing that, again, it's not necessarily something that each individual organization, has the capacity for, given the significant caseload. Maybe just quickly in my last 2 minutes, sort of actually on a similar theme to Catherine and Jackie. So yeah, really appreciate learning more about the Kickstart program. I think, a focus on youth is so critical. Again, just sort of thinking of some of the strength-based approach to looking at our community and some of the great resources to tap into. Have you had a chance, or are you already connected with the Youth Agency Collaborative?
Yes, thank you. We're connected with the Youth Agency Collaborative, as well as a number of youth serving organizations. Our initiatives are really complementary, and we feel that we kind of help with community organization at those bottom 3 layers. And then the Youth Agency Collaborative is really on the cusp of that higher level. And so we're really hoping to align and kind of leverage relationships that we have with our young people to be able to get them to the right services at the right time. Kickstand with the YMCA has been able to establish 16 partners who are planning to co-locate within the Kickstand Center, really kind of helping, I think, with what Sheila has talked about, figuring out what's out there for people is really going to help when we're all sitting around the same table, and providing expertise in our own roles and not having to try to be everything to everybody who walks through your door. So
excellent. No, that's great to hear. And thank you for helping me understand too, just sort of the different spaces in the continuum of care and support that each of these agencies is playing. So thank you. Thanks again to all our speakers.
Councillor Wright, please go ahead.
Thank you very much. Gary, I thank you for focusing your presentation on mental health, because I think the Minister of Mental Health and Addiction seems to focus more on the addiction side, and to all of you here, this report is about mental health, so thank you for that. I'm just wondering, you had one last slide left, Gary. Did you want to talk to that? It was calls for action, so I think that's kind of important.
Thank you, Councillor Wright. You know what? It's really, yeah, they're imperatives. Also thank you for raising that distinction. And my part of my optimism comes for the near future and for the farther future is really about you know, with all the focus on addiction and how polarizing that is. When it comes to mental health, it's not nearly as polarizing. There's a lot more consensus, broad consensus around what we need to do and what's missing. So, you know, with the focus on mental health, maybe we can all come together and hold hands. That's like, this is the moment that we can make this change. So anyways, with that, thank you for this. Again, humanitarian crisis, this isn't about vulnerable groups, right? Certainly it is, obviously, in high-risk groups and everything, but this is literally everyone everywhere, and especially when we talk about prevention and the services that the other speakers are providing. I mean, that is critical to that. The next is that every one of us needs to be better at recognizing and responding to mental health issues. This isn't about service providers. This is about all of us as individuals, as neighbors, as friends, as coworkers, as family members. So how do we get to that point where we are all competent and confident in recognizing and responding? And then I think ultimately, when, you know, there's been so much focus on outcomes, and there's a lot of externalities that feed into outcomes. When we talk about cancer, you know, we know that for a lot of people, the outcome will not be good, but we try to make sure that people have very clear, like, we do our best to comfort so that there's make it a predictable and pathway. And really, it's about the experience. It's about the experience of the individual, about the family, about the people around them. We need to take a similar approach, really focused on the experience and make it simpler. That's it. That's within our locus of control. A lot of things aren't. I'm a strong believer in the primacy of lived experience. I think with the overemphasis on the clinical side and medical, and, you know, all respect to doctors and clinicians, but you know what, if we turn that around and we actually had end users, people with lived experience driving the change that we need to see, we would start to see huge changes, because that's really the perspective that's been missing. And then my last thing really is, instead of pointing the fingers at government, including municipal government, we need to actually, as community members, we need to actually take action, you know, into our own hands, and we need to ask ourselves, what can we do as communities? What can workplaces do? Industry do? What can neighborhoods do? What can cultural associations do? That's where change will start. Okay, sorry, I'll get off my soapbox, and thank you for that opportunity.
Thank you. I appreciate that you have that soapbox to speak from. And actually, just something that you said about the lived experience, but I don't want to focus back on addictions, but isn't that sort of one of the things that I think it's Alcoholics Anonymous sort of focuses on, is those with lived experience helping others? Anyhow. And then I'm just wondering, in Mark's presentation, he talked about 90% are rated urgent or higher, yet it looks like only that 23% aren't treated or walk away. What can result from walking away from an emergency room when you're in that urgent or high crisis time?
I believe that question probably should be directed to Mark. Are you asking the speakers?
I was just sort of, from a mental health perspective, if someone is in a crisis and they don't get that urgent treatment, what happens? Catherine, I see you nodding your head. Do you want to, 20 seconds?
20 seconds. I would say that the outcomes are frustration. At the best opportunity would be frustration. At the worst, you lose lives. I think it impacts your family, your caregivers that are trying to help you. And I think we see that ripple in unmeasurable impact throughout our community.
Okay. Thank you very much. My time is up.
Thank you. Mayor Sohi, please go ahead.
Yeah, thank you. I just want to follow up with you on the effort that your organization is leading with United Way and the city on the mental health strategy, community-based mental health strategy. Can you speak a bit to that? And like, how do you see that as achieving some of the early intervention, community-based solutions, and engaging with people with lived experience? How do you see that strategy achieving that?
Thank you, Mayor Sohi. And yeah, I'm happy to speak about that. And I would look forward to a future opportunity to speak to council with our partners on that initiative. So really, it is about establishing that blueprint for a future system of care in community. And in order for us to, and I imagine it as like if somebody gave you a bag with a bunch of puzzle pieces and you don't know what the picture is supposed to look like, start to put all the pieces together, and you have like the borders, and you have a picture that looks like a tiger, and you have another picture that looks like a coconut tree or something. You start to say, okay, well, this is probably some kind of tropical, maybe Indian scene, right? In that way, we need to start to create this idea of what that future blueprint, like what that system of care needs to look like. But then we've been, for the past 2 years, actually, 2 years or more, we have a group of people with lived experience that have been kind of helping us shape what governance looks like. Because when we talk about decision making, it's one thing to have this picture of the future, but how do we get there? What do we prioritize or deprioritize to get there? Well, previously it was people in my position, people in like positions like mine, or people with power and influence that got to decide what was important or not important. Well, that needs to shift to people with lived experience and their families, deciding what is important, what do we need now, and how do we get to that end stage. So we have a prototype for this governance model. We have some draft pieces of the strategy that we're working very closely with United Way and the City of Edmonton with administration on this. I think we're expecting to have something to reveal in the next few months, but it's been an amazing process and very far-reaching process as well.
Yeah. No, thank you for that, and look forward to that conversation at the committee when the report comes to us for discussion. And I understand the fact that we have to have that kind of holistic approach, community-based approach. At the same time, there's a clinical aspect of this, right? But what I'm hearing is that the more we can do in the prevention and community-based interventions, you help with that severe cases of when people do that, need that clinical support. And also it helps with addictions. It helps with the overdose crisis that we are facing. It helps with preventing houselessness. All these are kind of interconnected, intersecting issues that we're facing.
So when we were first starting this process, it was Mark and Dr. Lee at AHS, where we talked about, okay, so there's the AHS planning, and there's this community side planning, and we just have to make sure that on the community side, we have sockets in the right places. And then on the AHS side, they have plug, or the other way around, whatever it is, so that in the end, you end up with these channels for people, these pathways for people to actually move between clinical services and community services, because that's how we get recovery. That's how we get wellness.
Yeah. So are you seeing in my last 50 seconds? So you will see a shift, or maybe not shift is not the right word. Maybe is you'll see more emphasis as well on the community aspect moving forward.
I hope so, and more than hope so, I believe so, and I'm working towards that. And I believe that Catherine and like Kickstand is a good example of how those things get integrated in one place.
Got it. Thank you so much. Again, once great work all of you are doing. Deeply appreciate. Thank you, Chair Principe.
Thank you, Mr. Mayor. Councillor Paquette, please go ahead.
Oh, thank you, Chair. So 41 days, we heard, is kind of a wait list for people to get into service. People who are in crisis who finally reach out probably don't have 41 days. And yet what I'm also hearing is we don't track that. We don't know, or do we? The number of people who go in to try to get service don't get the service, and then their lives become much worse if they're still even alive at that point. Do we track that? Do we have information about that? Anyone can answer. I don't actually have, I think everyone here is, I could pick someone unless someone wants to jump in. Or I'll just go with Gary.
The data is there, right? It's held in different places, and as Angela said, we don't have clear information sharing kind of protocols or permissions, frankly. I think at least what I can speak to, and then I think the other speakers should probably speak about their perspectives, that are the stories. And like I said, it's the same story that I've been hearing from, like, as long as I've been in this field. Exactly as you said, people are in crisis, and and we hear about police respond to somebody who's suicidal, they pick them up, they take them, and then a few hours later they're getting the same call, and then they're back at that same house, and there's that same person, and a big part of that is the follow-up. There's been so much focus on the emergency response, the crisis, even the phone lines, and obviously we appreciate phone lines, but what comes afterwards? Nothing right now. It's like, even like somebody needing tax help, well, fine, if there's a service that requires somebody to come on a Tuesday night and be or whatever it is, maybe that doesn't work for them. Maybe they don't want to do that, right? So I think there's a whole question about how do we make sure that the follow-up piece is that we're investing in that, and that we're actually more focused on the follow-up piece than the rest of it. I think that's my opinion on it.
Well, it seems to me that it's odd that we would assume that someone in a mental health crisis or in the midst of an addiction crisis has the wherewithal or the organization to handle their lives for 41 days when just reaching out was pretty much everything they've got, and they've got nothing left. They reached out, they were vulnerable, they made that effort, they get turned away. Are they ever coming back?
Councillor Paquette, do you have a question?
Yeah, the question was, are they ever coming back?
I can speak a little bit to, while we don't have that exact data anecdotally, and what we do is we track data within Momentum, and we know that over 40% of our clients are coming from AHS when they can't access those public services. And I could say the same, I could speak on behalf of the community of practice, that that's probably their experience as well. And so we're often the third, fourth, fifth door that these folks are coming to. And the fact that they have that wherewithal, or they have a caregiver that is ensuring that they live another day to try and access another door, to try and access another therapist or another service, it never ceases to amaze me. But it's not right. It's not ethical. It's awful. It's awful. And I think if we could pull the data, it would be shocking to see how many people don't make it those 41 days.
And I would echo what Angela says. I think if they're lucky and they have family who will help them, they might end up at a place like Momentum or Cornerstone. We do see people like that here. They're on a wait list, sometimes 41 days. Sometimes they're trying to get into a program. Maybe it's 3 months. And if they're lucky and they have somebody who says, hey, let's do this, then they end up at a place like that, like ours.
Yeah. In 20 seconds, I don't have the time to ask what the short, medium, and long-term solutions are, but that's something that we are always thinking about. Thank you, Madam Chair.
Thank you, Councillor Paquette. Councillor Wright.
Thank you very much. Gary, you would, in response to Councillor Paquette's question, you mentioned that EPS is being dispatched to mental health issues, whatever. Why? I mean, shouldn't we have social workers, EMS, somebody else responding to those?
Well, I mean, this is a uniquely Edmonton situation. Actually, sorry, no joking allowed either. I'm guessing by the protocol. this is commonplace. I don't know a single jurisdiction out there that doesn't have police responding to mental health crisis because there is a lack of a community mental health system, right? But then there's also the risk. Do we actually have a clear idea of how to assess risk? Because in some people's opinions, the only thing that actually guarantees risk mitigation is that you got somebody with a gun going, right? When we know that actually could be the wrong thing to do. But then how do you actually how do you prevent some of the very tragic situations that have happened? So this is where I'm talking about. It is about an overhaul. It's about a redesign of a pathway. We know we've been working with Edmonton John Howard Society and a number of different organizations around a post-crisis peer support model. In BC, they actually have a peer-assisted crisis team model. There are other models, right? But there is that deliberate kind of work that we need to do to redesign this. And we need people with lived experience to actually shape this. You talk to somebody who's been in crisis, a family member who has called 911, and they can tell you a lot about what happened. And they can also tell you about how they wished it happened differently. And I think that that's what we need to focus on. We work very closely with the Edmonton Police Service on this on imagining what the future could be like. They don't want their officers rolling out for things that they don't need to be either. So let's all work together is my sort of chorus.
So as part of AHS's restructuring and that, should there be more focus on, I think there needs to be more focus on a lot of things, but on EMS, having more paramedics, having more properly trained people responding to these kind of mental health crises?
I think, and sorry if I'm feeling a little frustrated, when you have the only tool you have is a hammer or a screwdriver, and then you have these other things like tacks and staples. So I think we've been responding to mental health needs with the only tools that we've had from the justice system and the healthcare system that was never actually built to address mental health or substance use issues. So when we talk about paramedics, when we talk about police, when we talk about first responders, firefighters, none of them were equipped to go respond to a mental health crisis. Frankly, emergency departments were never equipped to do that. So, and it's funny, you talk to 10 people out on the street and you ask them, well, what would you do if somebody was next to you was dealing with a mental health crisis? They say, well, I'd call 911, I'd go talk to my family doctor, go to the emerge, go talk to a psychologist. None of those 4 things are what you're actually supposed to do. Right. So this is where, we do need to take this opportunity. This is where my optimism comes from, to redesign this pathway and to have people with lived experience actually shape this, not just me or a doctor or social workers or clinicians. As informed as we are, as much knowledge as we have, really, we need to turn the tables around.
And you mentioned, thank you very much. You mentioned about the post-crisis team. Is there anything post-crisis for first responders to help them deal with what they shouldn't be dealing with?
There needs to be, and there are certainly, and this is sort of secondhand, within fire, EFRS and police and paramedics, but it's patchy, right? And it depends on in Edmonton, you might have some, but in smaller communities, you might not. Does it actually reflect other things like cultural issues, other family issues, or is it too narrow? I think that we could go a long way. And then what about vicarious trauma or even direct trauma for frontline workers in the social sector, right? So I think there's a lot of pieces that need to be put in place.
Okay, thank you very much. Appreciate your comments.
Thank you, Councillor Wright. And looks like we are done with questions to speakers. I would like to thank all of our speakers for being here with us today and also for the work that you do. Next, we will go on to questions of administration. So I'll ask my colleagues to please sign up to ask questions of administration. And at this time, I would like to remind my colleagues as well that Delegate Snaters is here presenting for AHS, and he is not representing the provincial government. So please be considerate and respectful with your questions. Councillor Knack, you selected this item. I will go to you first.
Yeah, thank you, Councilor Principe, and an excellent reminder. And so, really, I just wanted to ask, because I know when I started asking questions, our guest from AHS had unmuted to provide some feedback, and you've heard some of the conversation, and I guess wanted to get your take on recognizing, obviously, government sets the policy, they set funding buckets, all of that. I guess I wanted to just get a better sense of how things are evolving, recognizing sort of, and it's a challenge in every order of government with almost every area, that funding is not always consistent. It can be more sporadic. Sometimes it can be done on a one-year pilot. You had some thoughts you wanted to share those, so maybe I'll just start with you, leave that a little more open-ended.
Sure, thank you. So if the question is about stability of funding, everything that every dollar that has been spent by Alberta Health Services in the world of addiction and mental health is packaged up and is coming to the new provincial organization that is being created. So there is no loss of services, there is no loss of funding. And so I think that's an important piece, because back at the very beginning, I think when people hear about an organization being deconstructed, there's this sense of impending loss. No discussion that I've ever been part of has talked about funding cuts or budget cuts. In fact, they've been very, very careful to identify all of the funding that is spent in the world of addiction and mental health, so that there is no loss of service in this transition that's going to be occurring over the next months.
That's good. And maybe, and again, it might be better suited to a question to the province, or better question in 3 days once you have the budget. Do you have a sense of how that might be changing or evolving, or appreciating that, I think even in some of the presentation materials that you shared, we're seeing growing demand in certain areas. So great to hear that maybe we're not going in one direction. The question is, do you have the resources to deal with the growing demand and the growing need that seems to be happening province-wide, not just in Edmonton?
Yeah, well, I mean, even Alberta Health Services, we would always say, hey, we could always use more funding.
For sure.
And we are constantly working to become more efficient, to work with our partners to make sure that clients and families can get into the right service that is appropriate for them at that time. It might be one of our services at a point in time, and it might be a service of one of our partner organizations at a different point in time. So we're very clear that our patients need to be able to flow back and forth between our system and the rest of the system seamlessly. We're obviously not there yet, but I do think we have made headway over the past decade in creating a little bit more of a system, as opposed to just agencies doing everything in a fragmented way.
Appreciate that. Maybe a question to our city administration. I appreciate that this is a report that was based on emotion, just to get more detail, to get more information sort of coordinated away. I also appreciate, it's not like we have new money that we can suddenly start providing more funding for. So that's not really, I think, what's before us. This was really meant as an information report, but I guess I wanted to get a sense of with what you've heard today, are there any next steps that you're going to be working on, how we work together with these various organizations? I heard a lot about the support that city staff have been offering over the last number of years and well before that. I guess sort of what's our takeaway from this report? What's sort of happening after this is received for information?
Thank you for that question, Councillor Knack. This is Chelsea Horlock, the Director of Safe and Healthy Communities. As was expressed by some of our community partners that have signed up and Alberta Health Services, we are working quite closely with our partners in this space as the role of funder, advocate, and convener. And I think this report and some of the conversation here today just really validates our efforts in this space and continuing to connect with partners and have our finger on the pulse of what's needed from the municipality and how we can continue strengthening those relationships with other orders of government as well.
Great. Well, I appreciate that. And yeah, I guess I'm close enough down on time, so I'll leave it there. I might come back around. Thank you.
Thank you, Councillor Knack. Mayor Sohi, please go ahead.
Yeah, so maybe I'll just follow up on that. When does the community-led strategy conversation that cities having with the United Way and and Gary's organization. When is that report coming to a committee?
Thank you, Mayor. So we're currently expecting that the final strategy will be ready for release in Q3. And at that time, we will have to work. We don't have a set date to bring it forward to committee. So we will have to work on a date and figuring out the best way to bring that forward.
So, okay, Q3. Okay. Can you speak to the involvement of folks with lived experience in shaping that strategy?
With the governance, as Gary had kind of began to allude to, we are really working. We've spent a lot of time over the last year developing in partnership with our community partners and with a lived experience table, what that governance model looks like, because it is different. It's shifting the power dynamics from traditional governance structures. So in this model, we've described it as an onion model where folks with lived experience are at the center, and some of the other organizations, groups, leadership tables are the layers around the onion supporting the core of that. And we have roots and shoots of the onion that support who we're connecting with and how we're all connecting and coordinating as a sector. It's really, as Gary mentioned, a transformational model, and it's something that hasn't been done before. So through that, we've taken a lot of time and care to make sure that we are doing it right to achieve the transformation across the system that we want to see.
Okay, great. So look forward to that conversation. Shifting over to representatives of AHS, how do you see the work that Chelsea was speaking about, Gary was speaking about, and other speakers were highlighting? How is that kind of connected to AHS and intersects with some of the work that you're doing?
Thank you. That's a great question. I do see us being a very active participant, but this is something that is community-led. Mm-hmm. And so, but as Gary showed you, the peak of the pyramid, the organization that provides the highest intensity of service, I think we want to be very, very cognitive of what the broader community is doing to organize itself, and so that we can play any supportive role that we can possibly play. Mm-hmm. Our Access 24/7 that we opened up a number of years ago, the people coming into Access 24/7 looking for help, we're identifying people every day where the most appropriate service for them is not Alberta Health Services, but it's a community-led, it might be Momentum Services, it might be CMHA, it might be another community partner. And so we want to have all the information out there on all the services so that we can do those handoffs and we can do those warm handoffs and we can understand what's happening in the broader community. And I also just want to echo the importance of listening to our clients and our patients. We have a new workforce in Alberta Health Services called peer support workers. And these are clients who have lived the experience of mental health and addiction. And they are becoming part of our workforce. I think we have upwards of 45 to 50 peer support workers that are employed by Alberta Health Services, and they're embedded in our teams. And it provides that accountability, and it gives our teams more credibility with a lot of our clients when they have a peer support worker that is embedded and supporting the work that they do.
Mm-hmm. Is AHS involved in that community strategy discussions?
I think we're involved and as a partner, but not as a leader.
Okay, got it. Yeah.
If it's okay, I'll just add to that a little bit that AHS has been providing funding as well for some of the positions at CMHA to support that work.
Okay. Well, I have more questions, but I'll come back for second round, so I'll stop here, Chair Principe.
Thank you, Mr. Mayor. Councillor Wright, please go ahead.
Thank you very much. Just clarification on that peer support workforce. That peers to who? To workers within AHS, or to those coming to look for assistance?
That's a very good question. I should clarify. These are peers for our clients and our families, and so these are people.
Thank you. And then. Sorry, these are people, I didn't catch the last.
Sorry, these are people who have lived the experience. They have experienced mental illness and substance use, and they have recovered from it. And now they're being hired as part of our interdisciplinary teams across almost all of our programs.
Okay. And then I just want to confirm something. In your presentation, Mark, you had indicated 384 addiction and detox spaces. Are those are open spaces, or those are all spaces?
Those would be bed-based services. Some of them are operated by Alberta Health Services, and some of them, many of them, are actually operated by partners of ours that we fund to operate those beds.
Okay, now, and I know you're not here on behalf of the government or the minister or anything like that, but in a CBC interview I saw yesterday, the minister did say that there was over 2,000 spaces available and over 10,000 since 2019 have been established. So I just want to clarify with you, 384 is what we have available for people to seek treatment.
So the number that I provided was within the Edmonton zone, not provincially.
Okay, thank you for that.
And sometimes we can be, sometimes the word care space, if a bed is used for X amount of people over the course of a year, you might get more treatment spaces out of a funded bed. So sometimes the terminology between how many beds do you have and how many treatments are you able to provide, or treatment spaces, can make those numbers seem difficult to align.
So somebody with an addiction might be in an acute care bed that would otherwise be used for recovery from surgery or something, but that because if they're waiting for an addiction or a detox space, that bed in acute care would be considered part of the treatment, I guess?
Yeah, I think that's one way of looking at it. One detox bed, if your average length of stay in a detox bed is 5 to 10 days, then you can calculate how many people would be able to receive a treatment from that bed over the course of a year.
Okay. Thank you for that. And then with your access 24/7, I think you've indicated about over 45,000 people got connected to a community visit. What sort of continuing care or follow-up is done with those 45,000 people? Is it just one visit to a psychiatrist who gives you a prescription for drugs and then that's it? Or what sort of data do you have for follow-up?
The individual client journey is going to vary greatly according to their needs. So there are some people who actually do very well with a small number of appointments, maybe a visit with a psychiatrist, some adjustment of medications, some short-term counseling, and then they actually don't need our services anymore and they can graduate to something else. Other people might need an entire year of intensive case management with a team and physicians. So each person's, the intensity and the length of time they're in treatment is going to vary, and it's going to be individualized to what they need.
So all those 45,000 would have had continuing care throughout until their situation was resolved?
That's right.
Okay. None fall through the cracks, none don't go back?
No, I'm not going to say none fall through the cracks. We have clients who disengage from services. So there are clients, it's the nature sometimes of mental illness and addiction. That's why I think we want to be assertive. If people stop coming to us, then we need to reach out and we need to go to them and we need to find why it is that they're not engaging anymore. So I'm not going to ever say that nobody falls through the cracks. I think the nature of the illness sometimes will create situations where people disengage from services before perhaps it was ideal for them.
But there's no data to show how many get treatment in different ways, or those that fall through the cracks?
We would be able to identify the numbers of appointments and the degree of engagement that somebody had over the course of their year.
Okay, my time is up. Thank you.
Councillor Paquette, please go ahead.
Thank you, Chair Principe. I've got a number of questions. We'll see if I can get through them. To administration, we may not have these numbers. We might, but we may not. Do we know what the cost is to the city in aggregate in a year when it comes to calls to service for mental health or addictions through emergency services or what have you. That's it. Do we have those costs?
No, we don't.
Be interesting to take a look at. Do we know how much, for example, it costs one incident of maybe being called to an overdose if fire is coming or police or, and then we wouldn't have the AHS cost on that, but.
We could follow up and look what 2023 numbers were in terms of fire dispatch and what the cost would look like in terms of people and vehicles responding.
Yeah, that might be helpful. And then I know that there's way too much overlap to pull it apart. But when it comes to encampments and our costs of encampment management, encampment cleanup, those sorts of things, we don't actually have a count of how many people in those encampments are suffering from mental health or addictions issues, or do we, percentage-wise?
No, we don't have that information. That would be private health information that I'm not sure would be disclosed to a city.
Right, like if we had anonymized data, that would be helpful. We wouldn't ask for people's personal information, but there's no way we can get that information, obviously, but there's obviously overlap to it, and that is also in the tune of a lot of money. Okay, so
I can
go ahead.
That in the 2022 point in time count that was done, I'll check my numbers, but I think it was around 82% of people who were unhoused did have some mental health issues, but that was self-disclosed. That was not diagnosed. So that's just what folks, when asked in a survey, shared. So there is some point in time count, again, from 2022 that we could also add to that memo if that's helpful.
Okay, so to Mark then, is there times when people say, look, I'm having a lot of trouble, I feel like I got a mental health concern, and we say, no, you probably don't?
Well, I think on the other side, I think what we need to do is we need to take advantage of every little window of opportunity that we have when somebody is willing to reach out for help. So, I think our focus is on if somebody has that little bit of insight, that little window of opportunity that they need treatment, that there's something wrong and they need to reach out for help. I think what our teams are doing is trying to get that help as soon as possible, same day treatment. And I think on the opioid side, on the addiction side, I think we've made some huge gains over the last few years. When you look at the numbers of people who have engaged in treatment of their opioid substance use issue, we are treating more people than ever before and removing many barriers that previously existed to people getting into opioid dependency programming or opioid agonist therapy or having some form of treatment for their addiction.
Yeah. So, quick question to administration. Legally defined, I think I know the answer to this, but I just want to be clear. Who is responsible for healthcare in Alberta? Is it municipalities?
It is not. It is under the purview of the province.
Yeah. Okay. So this is an excellent report with excellent work. I'm super grateful for it. I'm just wondering, Madam Chair, if we should consider sharing this report with the province with an attached letter from the mayor talking about maybe some of the costs and some of the opportunity costs that happen with a lack of care and some of the opportunities that present themselves with proper care. I'm just testing, I guess, the chair's thoughts on that and maybe committee as a whole.
I believe you have the option of bringing that forward if you would like to.
Yeah, okay, great. I will directly message the mayor to see if that's okay. All right, thank you, Madam Chair.
Thank you. Next, we'll go Councillor Rice. Please go ahead.
So, Councillor Pacat brought a very good point. I want to follow on that to our HS representative. Is this report all those data, because this report actually very good information there. I really appreciate those reports, those data, and provincial government already has. So it's my understanding, and the AHS regularly shares the data with Alberta Health, and Alberta Health brief ministers, brief and all the department. So that's my understanding. So I just want to get it clarified on that.
So the data that was provided was intended to be, an overall snapshot that would give you a perception of the scope of services that we offer, the age of people that we serve, the volumes of people. It was intended to provide kind of that high-level overview of the services provided by Alberta Health Services. That pictograph has been shared with our ministry. I don't think there's anything in the numbers that is a secret, although I wasn't involved in any special briefings before the information was provided. The City of Edmonton's a great partner that we've been working with on many initiatives for a long time, and we felt comfortable sharing the information.
So that is what my understanding, and specifically gave the facts. The mental health is fall under the provincial authority. I think those type of information already shared. And in terms of what we heard, that is a report, and then Councillor Picard may refer to. So that type of reports is a good information and for share broadly as well. So thank you for that answer. And then I have another question to AHS representative. So based on what you heard today, and based on what our city has been doing, and then to support community need lots of programs and to address mental health and addiction issue. So is there anything you say our city's role could be improved or changed, or any other sense we could do? Or so I just want to get a sense from you, and because you work under directly and from Alberta Health, that is our province government. So from that perspective, what did you say city's role here? So is there anything we should do, continue do, or we should stop doing, or we're doing well, or we should improve? So I would like to get a sense from you. Thank you.
That's a great question. Thank you. In my experience, I've been in my role for almost 15 years. And I've worked with the City of Edmonton on a number of initiatives. And one thing that I always appreciate that the city does well is you bring people together. You have this way of engaging and bringing partners together that is very, very effective. I was part of your suicide prevention strategy, and when I was part of that, I saw the city bringing people together, creating a forum for information sharing and supports, and out of it came a robust strategy. So I really like the way that the municipality is supporting the community strategy. Addiction and mental health is one of these areas of healthcare that is unique because there is nobody who owns all the services. You are always going to have fantastic services being done by a huge, broad range of different organizations. And what I love about the community strategy is it's bringing those organizations together to form more of a coordinated, integrated, and cohesive strategy. And we will always want to be part of that, recognizing that we probably should not be leading it, but we always want to be a supporter and a partner as those strategies are developed.
So thank you so much, and that's excellent, Mark. And I do believe the collaboration and between the community, different organizations, and also integration resources, and is really important strategy and approach for us to continue. But my question is really looking for, maybe I put in the presentation, you may not be able to answer this question about the funding model. And because right now we heard today, we have the gap in the resources, we have the gap in the services, but how we address that, and from that integration, integrate resources, and also from that collaboration, and from all level of governments. So I know this is probably the big question, but I really appreciate your answer. Thank you so much.
I'll just ask that maybe he answer on the next round, if that's okay. Councillor Rice, we're out of time. Sorry.
Yeah.
Councillor Stevenson, please go ahead.
Yes, thank you very much. Really appreciate the report and all the information that's been shared. Also have appreciated that we've been focusing more holistically on mental health. But I do want to narrow in on some of the opioid related information that was shared, particularly sort of the stark geographic findings that 50 to 60% of opioid crisis intervention is happening in the Eastwood area, a large portion of which falls within my ward. So just wondering what sort of targeted response is being taken given those findings.
Thank you. Yeah, we try to focus our energies and attention in areas where we see more need. So there's absolutely no doubt that certain geographies within the city of Edmonton, we are more active in. EMS is more active. Addiction and mental health is more active in some of the mobile outreach that we do. That could be, more attention being paid by some of our mobile outreach teams, our crisis team, our police and crisis teams, mobile opioid response teams. So we will, in areas where we know there is more activity and a higher need, we will focus more of our attentions for sure.
Okay. So some of that is already happening then, sort of additional mobile outreach teams, additional resources in the area?
Yes.
Okay, great. And then, I recognize there's a bit of a tension in terms of, I do really appreciate the effort to be locating new services sort of across the city, ensuring that there's equal access in all neighborhoods. But again, wondering what thought process is, or what thinking is going into, again, ensuring that there remains to be access. So when new spaces are brought online, how are folks sort of, where we're seeing a really geographic concentration of these challenges, how are they then connecting to those new services?
Yeah, in our long-term planning, where we look at the geography of the city and we kind of break the city down into subzones, we can see there are areas that we have a strong presence in already, and there's areas of the city where we actually don't have much of a physical presence, and people are having to travel. So our long-term strategy for how to meet the needs of Edmontonians is to really look at subzones, look at parts of the city. What are the projections over the next 10, 20, 30 years? Is that going to be an aging community? Is that going to be a community of young families? Is it going to be a community of a lot of new Canadians? So that as we're planning services, we can plan hubs to go into those communities with the right services that will meet their needs. So we are in active strategic planning right now around certain, we're looking at the southeast, southwest, we're looking at West Edmonton.
Sure, and I guess my and I think that's very positive. That's great to hear, and really appreciate that perspective. I guess my question is maybe more about people who are currently in crisis in an area where we know there's a concentration by the data you've provided. How are we ensuring that those folks are going to be able to get out to services?
Well, I think what we need to acknowledge is not everybody's going to be able to come to us, and that there are many times where we need to go to them. And so, I think that we have clinic-based services. They tend to be clinics where people have a scheduled appointment, come in to see your psychiatrist or your therapist on Tuesday at 2:30 in the afternoon. There's a big part of our population that are not going to come to us, and so we need to go to them. And so increasingly, I think I see that as an area of growth, that we need to be going to people and meeting them where they are.
Great. Yeah, that's great to hear. Just another piece, sort of looking at the drug surveillance web portal. For previous years, we typically saw public opioid deaths or opioid deaths happening in public sort of consistently under, around 20%, consistently under 30%. Over the past year, we've seen that really grow to now be representing about 40%. Just wondering if we have insights around what's driving that, and again, what sort of response is coming into place given that increasing trend.
So I just want to make sure I understand the trend. These are people who are dying of an overdose, an accidental overdose in a public space?
Yeah, so I can come back, but this is just the location of opioid deaths at the Edmonton level public is up to 43% in Q3 of 2023. But I'm out of time, so I'll come back on my next round for that. Thank you.
And thank you. Councillor Jans, please go ahead.
Thank you. Just wanted to confirm a couple of things here. So do I read this correctly that there's a 78% increase in EMS overdose / poisoning responses from the same time period in 2022? Like between April to September?
I know there was a very large increase. I don't have the report right in front of me, but I do know that there are far more EMS calls for substance-related calls than there were before. That is definitely growing for sure.
Okay. And I also saw AHS Community Mental Health Services only 0.02% of the 2022-2023 visits were from folks out of town. Am I to infer it, if I'm understanding that, how we quantify it is 99.8% of our like resident Edmontonians? Is that correct?
I'd have to look at that specifically. I do know that actually a lot of the services we offer around, it's usually year-round, anywhere between 18 to 22% of people coming to access their services are coming from outside of the Edmonton zone. So I'm not sure.
What was that number again, sorry?
It's usually around 18 to 20%.
Yeah, okay. Yeah, because we hear that sometimes in the justice conversation about how a lot of folks are not, they're coming to Edmonton, they're not from Edmonton, and then they're here because of either discharged from emergency or discharged from prison or corrections. So that's why I thought that stat about 99% of people accessing AHS community mental health services were like Edmontonians. I found peculiar, unless by definition everyone who sleeps here one night is an Edmontonian, I guess.
No, I think I'm not sure exactly which specific program that was referring to. I could look that up. But overall, when we look at all of our services that we offer, around 1 out of every 5 people who come and access our services are from outside the Edmonton zone.
Okay, interesting. Yeah, so we are still it is consistent that we are still a service hub to the north and to the region.
Yes, absolutely.
Okay, I was wondering about, do you track around the youth versus non-youth programs, like how many youth resources or how many youth are turned away or not, or how many youth are turning up with the Stollery? Like I hear anecdotes of higher reports of youth need at the Stollery, especially around mental health, but those anecdotes are not data?
Yeah, no, I think that you could measure the numbers of presentations in an emergency department, and they are higher at the Stollery, and they have grown over the last few years. But so have the the people walking into our clinics. We've definitely seen an upswing in children and youth and young adults that are requiring our services, and we've seen them almost across the board. And so we've seen increases in emerge visits, increases in crisis calls, increases in drop-ins into our clinic. So we certainly have seen an upswing over the last few years in that. And
I really appreciated the reports. I really appreciated the infographics. They were very, very, very clear. But I guess what I'm trying to get a sense of here is how much of this is a result of we are the demographic changes in Edmonton. Like, we're a very young city. We have a tiny tidal wave of toddlers born 20 years ago that are now cresting into adulthood and highest acuity for mental health, addiction, violence, all those other pieces. We also grew 70,000 people in the last 2 years. So when I see your stats shooting up, I'm trying to get a sense of if we disaggregate population growth, if we disaggregate these other factors, is this a population crisis, a demographic crisis, a mental health crisis, a little bit of all of the above? And then how do we triage and respond accordingly?
I would say it's everything. I think there's definitely, the birth rate at Edmonton and the increase in people who have moved here from out of province. I would also say that COVID and the 2 to 3 years of the pandemic and the impact that had on social isolation amongst kids and youth in schools I think that also played a strong role in what we're seeing today in the increased volumes of people reaching out and needing our services. So I think it's a little bit of everything. And I think one of the strongest things for youth and kids was those years that we spent socially isolated in the pandemic. And I think we're now seeing the mental health impact of that.
Thank you very much.
Thank you, Councillor Jans. Mayor Sohi, please go ahead.
Yeah, thank you. Just want to follow up on that, Mark. I was going to go to when I was finished my last round. Of the 384 addiction, detox, and recovery beds, and then additional 259 beds for overnight treatment provided in the community, do we know how many of these beds are new, and how have the numbers of beds changed over time? I understand like beds being used multiple times by multiple people, but overall, I just want to see the gap. Are we closing the gap over time?
Yeah, thank you. Yeah, sometimes it's hard to tell by just looking at the numbers. You know, our government's focus on recovery has, you know, up to date, it's largely precipitated in an increase in bed-based addiction treatment. I think we have more beds than we've ever had before, and we have more. The barriers have been, there were some funding and some cost barriers that patients used to incur when they went into an addiction treatment bed. So that barrier has been removed. We have more beds that are funded than we've ever had before. And those were greatly needed because we did not have any increase in our treatment capacity for people with addictions for many, many, many years. A couple of decades, in fact. So we definitely have more people receiving treatment today than probably ever before in the past.
Do we know what this
thing coming on?
Like what is the gap? Like, nice to see some growth happening, but recognizing the need, do we know what the gap is still?
It's really hard to measure. It's really hard to measure that. I think that we said that at the very beginning, you heard and I think it was in Gary's presentation, that most people who are feeling addiction or experiencing addiction and mental health actually don't reach out for help. And so what we're able to measure are the people who do reach out. And sometimes what we've noticed is that as we've made navigation easier and we've created these front doors like Access 24/7, when you make access better, it can sometimes be you can be taken aback by the amount of people coming in. And so I think there's absolutely no doubt there is still an unmet need out there. It is difficult to measure. But the fact is that we have more beds than we've had before, and they're almost always full every day. So I guess that shows you that there was definitely a need there.
Oh, absolutely. And also another gap we hear is, first of all, access to detox, like how much time you have to wait. But once you have gone through detox, where do you go from there, right? So access to other supports in the community, such as housing or ongoing treatment. Those are you seeing those gaps as well?
Well, I think our preference is that if somebody has made the journey through detox and they have detoxified, if there's a willingness from there, our preference is to go door to door and get them from a detox program into a longer term addiction treatment program.
Okay.
And so that is the ideal. The ideal pathway would be somebody going through a detox program, being moved directly into a treatment program such as Henwood, which might be 30, 35, 40 days, and then directly from there into maybe some longer term sober living or one of our new recovery communities that's opening in the.
So is that gap in 30 to 40 days of gap from detox to treatment, is that putting people back into kind of the cycle of falling through the cracks and getting back into addictions?
Yeah, I think anytime somebody has just recovered from detox, sometimes that's all they want. They just needed to detoxify, and they don't have an interest in ongoing treatment. I think that is a window of opportunity that we need to make use of whenever possible. And we are doing more and more direct transfers from detox into treatment, but it really does have to be based on the willingness of the client.
Got it. No, thank you so much for your work, Mark. Really, really appreciate you joining us here today with our team and ongoing work that AHS is doing. We appreciate that. It's a very important organization. So thank you, Councillor Chair Principe. I got to go. We'll probably see you if I'm able to be back in the afternoon. Thanks.
Thank you, Mr. Mayor. Next, Councillor Stevenson, please go ahead.
Yeah, thank you so much. The mayor's questions are a great segue to something I wanted to cover as well, sort of on that theme of reaching out for help. So, I think there's going to be a narrative that individuals struggling with addictions, experiencing addictions, are not always reaching out for that help. But I also hear stories in the community just in terms of capacity issues at the George Spady Center, for example. So every day that the detox facilities there are effectively being at full capacity in their current location. It's incredibly, it's wonderful news that those services are expanding. But just, I think to the mayor's question, are we going to meet, are we closing that gap in terms of the full demand that's there, that we maybe know is there through people being turned away?
Yeah, that's a very good question. People receive detoxification in a number of different locations. Every day in our emergency departments, we have people who present and they end up going through their detox in an emergency department. We even have an inpatient unit, a complex medical detox unit at the Royal Alex specifically for that. We have the beds at the George Spady, and we're very happy that once they are able to move to their new location, that they will have an opportunity to expand their bed numbers. We also operate the Addiction Recovery Center, or ARC, and that's an Alberta Health Services run medical detox, and we're in the process of expanding that bed count as well, which should result in around 1,200 more people per year being able to receive their detox from just that facility alone. So we are definitely expanding capacity. We wish we could do it right away overnight. In our case, we're in the process of recruitment, and once we have our new positions recruited into, we can increase our bed number. Spady, there's they need to work on getting that new location of theirs up and running, and then they'll be able to expand. And we also have a small medical detox program that's operated out of Poundmaker Lodge that also serves, the city of Edmonton and a lot of our Indigenous communities.
Great, excellent. Well, it's wonderful to hear the focus on expanding that capacity, so that, as you say, when people are reaching out, that they can be brought in and provided those supports. So again, just recognizing my time, I don't want to test the patience of my colleagues too much. So circling back to this increase that we're seeing in the proportion of deaths that are occurring in public, just any thoughts on what's driving that, and again, sort of the response that's being taken?
Well, I know that one of the disturbing stats that I see is when EMS is called out to resuscitate somebody who has had an accidental overdose, accidental poisoning, less than 50% of those people are willing to be transported to an emergency department. And so that, to me, that's an opportunity that's missed for that person to perhaps experience some ongoing care, ongoing assessment, get connected to services. So, I think we're really trying to work with EMS to identify, when does that happen? Who are those people? Why are they not wanting to be conveyed to an emergency department? And what could we do from a mobile outreach perspective to try to get them linked to services if they're not willing to go to an emergency department?
Interesting. And then just very quickly, my last minute, I've been hearing it. So my understanding, again, from the online data, there's about 9 publicly accessible supervised consumption sites in the city right now. And I'm hearing in particular a need for supervised consumption sites with inhalation options. Just wondering if that's on AHS's radars, or what the plans are around that.
Yeah, so I think we have 3 supervised consumption services in the city. 9 might be a provincial number. but we have
Booths, specifically booths.
booths. Okay, yeah, so sorry, yeah. You know, inhalation, it is, yeah, that is a gap that has been recognized, that people who inhale, I don't believe we have any supervised consumption today in Edmonton that can manage inhalation.
Okay.
So it certainly is something that we're hearing about, and we'll need to do some planning for.
Great, really appreciate it. Thank you so much for being with us today.
Thank you, Councillor Stevenson. Councillor Rutherford.
Yeah, thanks. Appreciate everyone being here. Just a few questions that keep kind of rolling in my mind. Our first one around acuity, and I guess I'll start there. I find often with many systems, and including the mental health system, you know, rightfully so, we tend to put a lot of resources to those in most critical acute mental health. And then I see there's this big band of people that are on the brink and the cusp. And often their only option is to really pay for mental health care separate from the system. And I think that's creating a big barrier and putting a lot more people to fall into acute mental health situations. I wanted your thoughts on that.
Yeah, I think what you heard from some of our speakers who provide a lot of those services, it's the early intervention, it's the it's the focused counseling, the shorter term interventions that can sometimes, if it's available early on, it can prevent somebody from needing a hospital, down the road, or an emergency department down the road. So, I think access to those lower tier, lower intensity but quick interventions, I think is something is quite important. I always think everybody who is calling their crisis team or is coming to an emergency department, there must have been some intervention that could have been done earlier that, if it was available and accessible, that might have prevented that admission to hospital or that presentation to the emergency department in the beginning. So I just wholeheartely agree.
Yeah, I guess what I struggle with is sort of it feels like for me there's almost like two parallel systems in the mental health. There's the public, I'm actually going to say 3 tiers, because I think there's the public system, the nonprofit system, and then there's the private system. They're all doing different things within the mental health sphere. But when I talk to residents from personal family experiences, the biggest barrier to getting help and getting consistent help is cost. Okay. Because one cycle, like if you don't have coverage, or if there's a wait time, or you don't meet the criteria to get into Alberta Health Services, you can go and you can pay a mental health professional, but that's around averaging $200 per hour. Correct. So I just wanted to know, what are we doing with our system's capacity in Edmonton, knowing that I heard you say, you're seeing more and more people coming into it, especially on the acute side.
Yeah.
What are we doing to strengthen the public system across the spectrum?
So a lot of that, a lot of our family physicians belong to primary care networks. Every primary care network offers some kind of lower intensity addiction and mental health programming. That those could be behavioral health consultants, they could be psychologists, they could be mental health nurses. Those services are free and often accessible through your family physician. So in the corporate world, a lot of attention paid on employee assistance programs with free supports and benefits that do extend to families. So those are 2 areas of growth that are often low cost or no cost. There's increasingly more virtual and online supports that can sometimes be very, very effective for people who are in need and can manage some of those supports.
Sure. And maybe I'll get a bit more personal here for youth, because you're seeing an increase in youth.
Yeah.
My son has some mental health. It took 3 years to see a publicly funded psychologist. 3 years. And they have sent out letters saying that they have to stop seeing patients because their demand is so high and they don't have capacity. So they're having to basically treat them, diagnose them, and then move them on. That is a current personal experience, and one that I know is with a child that has very strong advocacy parents, obviously. I don't really know what my question here is, but I think that, like, it's great that we're talking about all this, but the reality of people on the ground is very, very different. And I don't know how to rectify those two. I don't know. Maybe I'll come around again, but just leave it there with my time.
Councillor Rice, please go ahead.
Thank you. Thank you, Chair. Principally, I really appreciate those great discussion and the conversation today. And then my colleagues asked lots of good questions. My first question to City Clerk and for the procedural and for the decision making. I know, and my colleague Councillor Paquette has a motion I want to put on the floor. And is that we received this report as information first, and that motion becomes a subsequent motion, or what's the process? And can you provide some advice on this?
We can. I understand we can, but we don't have to. It depends on the chair and how she would like to proceed.
So I want to get it clarified, and we receive it as information and then subsequent motion, because I do notice the motion has a different parts, like 4 parts at least.
You have the floor right now. If you would like to put this on for information, to receive for information, you could do so, and then Councillors Paquette could be a subsequent motion.
So I want to discuss with my colleague Councillor Paquette. Then would you like to do the subsequent, or?
It really doesn't matter. Honestly, we can receive for information, or this motion supersedes the requirement to receive for information. So either way.
Okay, so in that case, I would like to receive as information first, because this is really important to acknowledge the work has been done and by city administration and work with communities as well.
Thank you.
So I would like.
All right, so we have a motion on the floor now. And would you like to speak to it?
No, there's no
speaking. Questions?
No, I have one very quick question to the city administration. When this report generated, and how much effort or how much work we have been doing with province together, and also with the community, definitely with community, it's really obvious. Is there any work collaboration already done and with province?
I'm sorry, just to clarify, you're asking what is the level of effort that we have undergone in our collaborations?
Yes, and to generate this report.
Oh gosh, I'm not sure we can quantify how many hours and how many people. We work until the work is done. We have excellent relationships that we leverage across the system, and we are happy to do that work.
So that means this report, when we generate the report, the work collaboratively with province, department, communities, service providers already done.
Well, this particular piece of work that was the topic of discussion was an AHS product. So I have to give credit to Mark and his team.
For this report?
That's correct.
Okay, thank you very much. That is only the question I have.
Okay, thank you, Councillor Rice. Councillor Paquette, please go ahead.
So are we going to finish questions on this, then receive it for information, and then put a subsequent on the floor? Because honestly, it's redundant, but we can if we want. It is redundant, just FYI. Okay, so I will wait then to put my motion on the floor. And I should also mention that Councillor Knack did select this item. Okay, thank you.
Councillor Rutherford, please go ahead.
Yeah, I ran out of time, and I saw that there was a response, and I wanted to just give AHS a chance to respond further to my comments, because it sounded like you did have something to say, Mark. I don't know if you still want to say it, but I just wanted to make sure that we didn't cut you off from getting a chance to respond.
Yeah, thank you. I just wanted to acknowledge how difficult that would be for you as a mom, and for all parents out there struggling to get their kids connected to the supports that they need. Yeah, my heart goes out to all of you. And when it's that difficult, and you are, somebody who is a fierce advocate, just shows you how much further we still need to go.
Yeah, I agree, and I share that personal story, knowing that it is personal to me, but it is not unique. And I often think to myself, as I've been going through this experience with my son in the mental health system for almost 6 years now, is, geez, man, I'm lucky that he has me and his father, and I'm lucky that he's has issues that are bad enough to also get the help he needs. Right? Like that's and that's kind of a weird mental space to be in. That's a very weird mental space to be in. And I just think, I guess I'm speaking to it for information now. I'm just speak to it at the same time, but I think that, this is great. And I have no doubt, the amount of work that are within our control we do as a city is there's that commitment. I can hear the commitment from Alberta Health Services, and I know you're aware of the issues that do exist in our system today, but I do think, we really need to, as was mentioned by the Canadian Health presentation, that other band, that preventative and that non-acute care, I think is so important, especially for youth that are continuing to fall into acute care as they get older. And so, my hope is, if there's any way that the city can partner with AHS, if you have ideas, let myself or my office know. We'd be happy to work collaboratively in any capacity we can. So thank you so much for being here today and for sharing this information with us. And thank you to administration for your work on this as well.
Okay, so Councillor Rutherford has spoken to the motion that's on the floor. Were there any other questions to administration? Councillor Paquette, did you have any more questions?
No, I'll just wait to make my subsequent, and at that point, with my subsequent, it's probably the best time for people to speak.
That sounds good then. Okay, then I'll ask my committee colleagues to vote on the motion on the floor, please.
We have all the vote.
Please display the vote. And that has carried. Councillor Paquette, would you like to go ahead?
Thank you, Madam Chair. I move that Community and Public Services Committee recommend to City Council that the Mayor, on behalf of City Council, write a letter to the Provincial Ministers of Health and Mental Health and Addictions outlining city costs associated with providing emergency services related to mental health, addictions, and drug poisoning incidents, and opportunities for collaboration, provincial investment in Edmonton, and/or a future roadmap of future council work and reports, and include a copy of the February 26, 2024 Community Services Report CSO 1745 with this letter. And I'm assuming that in the text of this motion, administration will also be sending the attachment. And just to introduce it, in the spirit of working collaboratively with other orders of government, part of that is information sharing. And this is really excellent information that our administration and our community partners worked on together to provide. And it is possible that with their workloads, that sometimes ministers may not be aware of a lot of the challenges that municipalities face, that the people in municipalities face, and sometimes they may not be aware of the dire situation in our streets and how that affects our budgets and our economy. One thing that wasn't included in this motion, which I would have loved, but there's no way to quantify it at this point, is also the cost to our community and the cost to our businesses when we have these unaddressed crises. And I am certain that there are studies that can detail that. We just simply don't have those studies available at this moment in a Edmonton specific context. But it is important to recognize that. So that would be the introduction of the motion. Thank you, Madam Chair.
Thank you, Councillor Paquette. We have 3 minutes before lunch starts. Would anyone like to speak to this motion at this time? Councillor Rice, please go ahead.
Chair Principe, I think the first one I would like to ask a question before I speak. From procedural.
Yes, do you have a question?
I do.
Point of order,
Yes.
Madam Chair. If the questions are extending past the 12 noon mark, we need to extend orders. Otherwise, we can return after lunch to continue the questions.
I'm okay to return after the lunch break. We can resume like 1:30.
Okay, so how about if we recess at this point then, and we will be back at 1:30 to continue on with this item.
Sorry, Madam Chair, really quickly, just to make sure our guests from Alberta Health Services probably don't need to be back. I just want to save them some time and maybe any guest speakers that don't have to come back.
Yeah, thank you for pointing that out. Is there anyone that would have any more questions to our delegate from AHS?
My question just to city administration.
Okay, wonderful. So I would like to take this opportunity then to thank Mark Snaters for being with us this morning, and to all the speakers that came as well this morning for all the work you do. Thank you very much. And we'll go in recess now, and we will see you back here at 1:30. Thank you.
we are live. Thank you.
And thank you. I'd like to call this meeting back to order, and I will start with the roll call of committee members first. I do not believe Mayor Sohi has joined yet. Councillor Rice?
Good afternoon.
Good afternoon. Councillor Knack?
Good afternoon.
And good afternoon to you. Councillor Paquette? Sure, he will join us shortly. I'll just go through my other colleague members. Councillor Wright?
Good afternoon.
Good afternoon. Councillor Stevenson? Councillor Paquette?
Hello.
Hello. Councillor Tang? Councillor Hamilton? Councillor Rutherford? Councillor Salvador? Councillor Cartmel? And Councillor Jans. All right, so we will continue on with questions to the mover and administration. Councillor Rice, please go ahead.
Thank you very much, Chair Principe. First question to city administration, and because from this morning and all the speakers, we heard there is a gap and between the demanding and also the source. Do you see this motion will provide a solution or provide the next step actions and for us to fill out that gap?
I'm not sure that the intent of this motion is for the city to fill that gap as much as it is maybe to demonstrate that gap, because I think that we've recognized that the responsibility and accountability for health services lies with the province. So that's how I'm interpreting it.
Okay, thank you very much for that clarification. So then my question goes to the mover. So this motion is just to demonstrate the gap. Is that the intention for this motion?
Well, that's a good question. No, that's not the only point of the motion. That is definitely one of the aspects of the motion. The other is having that open collaboration and communication with the provincial government, something that a lot of people in the public are saying we should be doing more of, and I agree. The other thing that this does is it creates a paper trail of communication. So when someone says, hey, what are you guys doing about mental health and addiction within the city of Edmonton? And we point to that letter and this report attached to it and say, well, this is how we're communicating with the provincial government. Later on, we'll probably get some more analysis that shows the fiscal impact on our communities and on our businesses. And we can then send a follow-up letter, for example, that says, okay, pursuant to the letter that we sent you in winter, here's the updated information on the impacts of addiction and mental health on businesses and community. And in this way, we show our work. Otherwise, what happens is we get a minister who could come to the city of Edmonton or to the public and to press and say, hey, the city of Edmonton really needs to do something about this mental health and addiction stuff in their streets. Why aren't they doing anything about it? Maybe we should look at policing or whatever it is they're going to do, which we've seen in the past. I'm answering the question. And that happened to us with the Justice Minister because we didn't have this paper trail of communication. It's vitally important that we have this kind of communication open and that we keep continuing to have these communications on an iterative and step-by-step basis. So does this solve everything? No, that's not the point of it. But does it actually show our work to the public?
I'm sorry, I have to mind for my time, and thank you, Councillor.
Well, I know that, but you asked me a very important question, and you should have given me the opportunity
I know every question Councillor asked is really important, and not only my question is important. Everyone.
Councillor Rice.
I do have
Councillor Rice. Councillor Rice. I understand this is your time, but you did ask me a question, and I was answering it in full.
Okay. Thank you for the answer, but I do need to mindful and for my time, and I do have the question. You mentioned say later on we can send another letter, and for that later on, and do you think we need some action to get that analysis results to have that information for the later on to send another letters? So then my question to you is, where is that portion to be reflected in this motion to to say we need to take the next steps to gather the next later on information and to follow up to send on. So that is something I'm concerned, because in this motion, I didn't say that next steps to be included there. And then maybe this question could be answered by city administration or could be answered by mover. But as long as we have very clear next step to be defined, and in the motion, I know this is really important topic everybody passionate about, including myself.
From an administration's perspective, I think that our work with our provincial and federal counterparts is a conversation. It is ongoing dialogue. It is ongoing advocacy. So I would never want to limit our outreach to just simply letters. I think it is assumed that this continues a very important conversation, provide some data to back up those conversations and to support further advocacy efforts in the form of dialogue.
Oh, that is actually great. And what I heard is very clear. We already have that ongoing efforts, collaboration, works in the press, and it's not only limited to the letter. But I do understand, and from Councillor Paquette, mover's perspective, you would like to have some like paper trail and to really demonstrate what we are doing right now here. But my focus is what specific action really could meet that outcome we want to fill that gap. So is that one, and
Sorry,
we can...
Councillor Rice, sorry about that. You're over time now. You can come back for another round if you like, okay?
And I don't need to, I can speak for this. Okay, thank you. Thank you, Chair.
Thank you. Councillor Paquette, please go ahead.
Yeah, just a point of order. Just out of respect for the processes, when we are asking people questions, we should give them time to respond. And if we are citing concern for the time that we're using, we probably shouldn't go almost a full minute over our allotted time. And there was always time for second rounds. Thank you, Madam Chair.
Okay, any other questions? Anyone to speak to the motion on the floor? Councillor Rice, please go ahead.
Thank you, Madam Chair. And I really want to say respect the process is really, really important. I just did every councillor did and to mindful my time. I have no intention to try to cut somebody off or to not allow anybody to speak. And also for me to receive the information, because my intention is I really want to demonstrate to respect the work our city has been doing. That is the intention. So there is no right or wrong for the questions, but we should respect everybody equally have rights to ask questions, to express their comments, and as a councillor. I just want to say that very clear. And also I appreciate this intention for the motion. So I'm going to support. And then it's not about I challenge, I ask questions, it's not about I'm not going to support. The reason for me to ask questions because I really want to make sure any motion we put on the floor could lead into the action we could take and to the outcome and goal we want to achieve. This mental health addiction and then issues, and we talk about over and over. I believe, and we as a city, we did lots of work, and also other order of the government, they did their work. But the challenge piece here is, and how we work together to address that gap we heard in the morning from our public speakers. This is so important. We do not want to miss that, because but the ending gap to be filled is not only about through the letter, and we need through the actions. I'm asking where that action piece could be reflected and in those motions, and for our administration to move forward, to continue to do their work, and also, and for our council from policy perspective, we can identify something and could be, and then reflect. This morning I mentioned that collaboration efforts and also integrating resources. And there are so many things we could do it. I really wish my colleagues could understand my intention here, my passion here, my caring here, and for the people and in our society who needs this help. And it is not just interpret and into the certain point of order. I want to say that very, very clearly. So my hope and from this motion is, yes, we can demonstrate that gap, but not only the demonstrate, and how we can find a way from policy perspective to really address that gap, to fill out that gap. I know there are so many factors could be considered into this process, but at least, and we should have very clear vision what we want to move forward. Thank you very much.
Thank you, Councillor Rice. Councillor Paquette to close.
Oh, sure. Not a lot to say. Just that I accept the apology, Madam Chair. And I also do think that there's no way to encapsulate all of these issues into one. And there's no way for the city of Edmonton to solve all of these issues on our own. We see the impacts of these issues in our streets and in people's individual lives, both the people who are suffering and the people who see the suffering and experience it secondhand. These are very real experiences that are negatives to the city of Edmonton. We also know that when we have folks coming in from abroad or from out of Edmonton looking to invest, one of the things they look at is, what's the state of the city? What's the state of the streets? How do people live in this city? Are they well taken care of? Do they have jobs? Do they have supports they need? And when we cannot demonstrate that, that actually impacts the kinds of investment people make in our city. So it has a larger economic and social impact than we are discussing here today, but it all ties into each other. Another thing that I am concerned about is that without this conduit of open communication going back and forth on a more regular and precise basis, the understanding of the issues in Edmonton streets may be lost with ministers who are very busy. They have large portfolios. They may not have time to think about this, but if they and their teams can be kept apprised of what we are seeing and what we are doing, then my hope is that can only lead to better outcomes for the people of Edmonton and, frankly, for people in all municipalities across Alberta, as the work that we do can have a positive resonating effect. So I hope that this gets support, and I hope that we look at this as just one step in an entire path of communication with the province. Thank you, Madam Chair.
Thank you, Councillor Paquette. I'll ask my committee colleagues to please vote now.
We have all the votes.
Please display the vote. And that has carried. Thank you. Next, we will go to item 7.2. Does administration have a presentation for us?
We do.
Well, please go ahead.
Just wait for it to come up here. There we go. Good afternoon, committee members. We're here today to present the results of the Popup Dog Parks evaluation and potential next steps, as well as provide a brief update on ways which we establish off-leash areas for residents to use. With me today is Craig McEwen, Branch Manager of Parks and Road Services, and Mark Beer, the Director of Infrastructure Operations. We also have a cross-functional integrated team that from across the organization to help with any questions that we may have, and they'll be available virtually, including community standards, neighborhoods, and integrated infrastructure services. And I will pass it right over to Mark, and he'll take you through the presentation.
Thank you very much, Eddie, and good afternoon, committee members. Dog off-leash areas continue to be of interest to Edmontonians, both those that have dogs and those that do not. Off-leash areas provide opportunities to connect community members, increase animation of spaces with the presence of more park users, and can help reduce unsanctioned human and dog activity on parkland. Integrated planning, design, and management are essential for the continued success of off-leash areas. In 2023, the city introduced pop-up dog parks as part of a continuing effort to innovate and improve programming on parkland. This pilot program trialed provision of temporary, city-maintained off-leash areas in neighborhoods with identified need. In total, the city operated 19 pop-up dog parks between May and October. All pop-up dog parks were equipped with garbage cans, dog waste bag dispensers, and signage. 16 of the locations were fully enclosed by temporary metal fencing with barrier-free gates, and 3 locations were unfenced. In order to select the sites, the program team engaged with community leagues, homeowners associations, utility companies, and internal stakeholders to identify barriers and opportunities for potential pop-up dog park locations based on their distance from existing off-leash areas. Sites that were being used for formal recreation, community activities, or that had other conflicts were removed from consideration. From there, the public was invited to complete an online survey about the proposed locations. Postcards advertising the survey were mailed to 142,000 residences in 37 neighborhoods that were being considered. Temporary signage was also placed in all of the proposed locations with information about how to provide input. As a result of that, the city received over 6,500 responses, which informed the final selection of the 19 sites. Next slide. This map shows all of the off-leash areas across the city, which is attachment 3 in the report. The blue indicators are the locations of the pop-up dog parks. And as you can see, these sites were primarily located in areas that did not have service by existing off-leash areas, which are orange and pink respectively. Administration conducted an evaluation of the individual sites and the pop-up dog park program as a whole within the framework of the Dogs in Open Spaces strategy, the Animal Licensing and Control bylaw, and other city policies. And the evaluation was based on public input and technical considerations. So from a technical consideration standpoint, this included current and future operations and planned use of that land, field site evaluations, and usage data. Public input included an online and paper survey and in-person public feedback sessions that were advertised to both park users and residents in surrounding neighborhoods. Feedback from 311 notifications, emails from residents, and councillor inquiries were also included. Overall, the program was well received. Over 2,800 people, both users of the parks and residents in the surrounding neighborhoods, completed the Pop-Up Dog Park Phase 2 evaluation survey. And here are some of the results. 60% would like to have a pop-up dog park in the same location. 14% would like to have a pop-up dog park in the neighborhood, but a different location. 20% would not like to have a pop-up dog park in their neighborhood, and 6% would not like to have any pop-up dog parks in Edmonton. Through the evaluation process, administration identified 9 pop-up dog park locations that could feasibly be transitioned into ongoing off-leash areas. These are the yellow and green highlighted locations in attachment 4. The map on this slide shows the distribution of ongoing off-leash areas in orange, future planned sites in pink, and blue for the 9 sites that could be transitioned. Administration also identified several opportunities to improve the pop-up dog parks program, such as expanding temporary or seasonal parks to year-round opportunities, updating site selection criteria to include winter planning, and increasing communications and site programming opportunities through community-led channels. Currently, administration is not resourced to transition these sites or to extend the pop-up dog park program past the 2023 trial program. Costs associated with various options for ongoing operations are included in attachment 6. It should be noted that this service would be considered non-core, and the city does offer other methods to establish off-leash areas. So in closing, as Edmonton grows, the demand for off-leash areas will continue to increase. The city continues to offer several ways of establishing new off-leash areas through other existing programs. These can be led by administration, by developers, or by community leagues or other organized groups. Since the Dogs and Open Spaces strategy was approved in 2016, 7 new off-leash areas have been established and 11 existing off-leash areas have been enhanced. One of the new off-leash areas recently opened in Pleasant View with temporary infrastructure as part of the Building Great Neighborhoods Renewal Program and will be completed this year. 2 additional off-leash areas are scheduled for construction in Otwell and downtown as part of Warehouse Park. 1 new developer-led dog park has opened in the Orchards and is expected to transfer to the city later this year. 7 community leagues participated in the Community League Dog Park program, which was formerly known as the Rink Pilot, to operate off-leash areas within fully enclosed spaces within licensed areas. 2 of these community leagues received multi-year licenses to operate the off-leash areas year-round, and this program has now been running for 6 years with positive feedback overall. Off-leash areas were added as an available amenity within community group-led construction in January 2023, and we were at committee to discuss that earlier last year. No project proposals have been received, but this remains an option for community groups to fund and operate off-leash areas on licensed land. Thank you for your time today. This concludes our presentation, and we can take any questions following questions to speakers.
Wonderful. Thank you for that presentation. Next, we will go to our speakers. First, we have Andrea Grunier. Are you there?
Hi, I'm here. Can you hear me?
Yeah, we sure can. You have 5 minutes. Please go ahead.
Thanks very much for having me. My name is Andrea Grunier. I'm a resident of the Beaulieu Heights neighborhood, one of the areas that's under consideration for the more permanent pop-up dog parks. I'm also a dog owner, and I'm very glad to be able to have a chance to come and speak to you today. I really just wanted to come and have a chance to express my and many of my neighbors' thanks for such an innovation and for the consideration of keeping it permanent. I'll say that for dog owners, it's really been a great opportunity to have a place that you could bring your dog to run around freely without any concern about young children or others who are afraid of dogs getting too close to them or being scared, as well as it gives them a chance to be off leash. But I think more than that, one of the things that we especially noticed was what an amazing community building opportunity this was. This was really a chance for neighbors who might not otherwise have crossed paths to get to know each other. Many people would plan to meet up. They would have sort of regular schedules when they would get a chance to communicate and connect with one another. It also was a great use of the park that wasn't really previously in use. It was a big section of a pretty large space that has a playground in one area, sports fields in another, but a section that really wasn't used for anything. So it was really nice to have an opportunity to see this part of the land get used and to get used so well. That's really all I had to say about it. And once again, thank you for giving me a chance to speak here today.
Well, and thank you for being here. Next, we'll go to Kevin Matheson. Kevin, please go ahead. You have 5 minutes.
Hi, can you hear me?
Yes, we can.
Perfect. My name is Kevin Matheson. I'm speaking not only for myself and my dog Louie, but for my community members of Summerside as well. After enjoying the pop-up dog park in Summerside last summer and then having to continue on without it in the fall, I firmly believe that our community is better off with a permanent dog park in the same area, and I'm here to tell you why. My fiance and I moved to Summerside in January of 2023 and didn't know anyone and were not particularly great at meeting new people. That all changed when we got Louie in the summer and started going for walks around the neighborhood and eventually utilizing the Summerside dog park. Immediately, we found ourselves meeting new people, first talking about our dogs, their breeds, and where we got them, the typical dog park stuff. But eventually, I found myself receiving tips regarding dog training. These conversations quickly evolved, and before I knew it, I was getting suggestions regarding things such as planning our wedding. This is quite obviously anecdotal, but one look around the dog park and you would see that the dog park had this effect on hundreds of people. Prior to this meeting, I posted in our Horizon Community Facebook group asking what the dog park meant to others to see if others felt as passionate about it as I do, just to make sure I hadn't become the crazy neighborhood dog guy. I didn't. In an evening, I received over 20 various comments regarding what the dog park meant to others, but I noticed a general theme. It's positive for everyone in the community. it's a safe way to train and socialize our dogs, and its location is convenient. Convenience is something I wanted to touch on for two different reasons. One, it's really easy to become a dog owner. It's not easy, however, to be a good dog owner. It requires getting your dog out for daily exercise. Anyone who has a dog will tell you that when they don't receive enough exercise, they become difficult and destructive, as well as loud and annoying, not only for their owners, but also for their neighbors. Personally, on days where I can't make it to an off-leash dog park, I go for a 30-minute walk at 6 a.m. before work and a 45 to 60-minute walk in the evening. This is a lot of work, and unfortunately, very few dog owners are able to make that commitment. I find that 45 to 60 minutes at the dog park is far more beneficial for Louis than all the walking I do with him. Unfortunately, far too many dogs get rehomed or surrendered because the people who get them don't understand the commitment that it takes to meet a dog's needs to keep them from being difficult. Easily accessible dog parks can play a significant role in mitigating this problem. My second point on convenience is the time it currently takes to get to an off-leash area right now. Personally, I find myself going to Jackie Parker Park as it's the closest park with the most dogs. I drive 15 to 20 minutes both ways. That's up to 40 minutes of my evening spent driving. In a city where efforts are being made to install bike lanes and introduce electric buses to reduce emissions, and where the aim is to create a walkable community with amenities nearby, why am I spending nearly an hour driving just to get my dog out? The last point I'd like to make is for all the people who don't like dogs. Good dog owners are like skateboarders. We're going to get our exercise in one way or another. Teenagers used to get in trouble all the time for skateboarding and doing tricks in front of malls, stores, and schools. So what did the city do? They gave those kids a place to go. They put in skate parks. Currently, if you go to fields around Summerside, more likely than not, you'll find a few dog owners letting their dogs off leash where they shouldn't. So now we have dogs often running up to others, going for walks, running towards kids that are tobogganing, and in some cases, leaving messes behind for people like cranky old Susan to step in. And Susan can't stand dogs. The park clearly makes a ton of sense for dog owners, but it also keeps dogs away from people like Susan who aren't a fan of dogs. But it also keeps dogs away from people like Susan who aren't a fan of dogs. So please, just give Louis a place to go. We have community members already offering to supply waste bags and asking what else they can do to support this cause. The community is begging for this. So please, for the community, for Cranky Susan, and most importantly, for Louis, make it easier to be a responsible dog owner. Thank you.
And thank you. Now we will go to questions to our speakers. Councillor Knack, please go ahead.
Yes, thank you, Councillor Principe. Appreciate you both being here. Thanks for the story about Cranky Susan as well. That's good. One quick question. So I've heard a ton of support as well. There were 5 locations in the ward I represent. Similar feedback to what you've shared. Really, the biggest question is, how do we fund this? And because every dollar matters, everything's this. So one question I put out, and I'm just going to put you two on the spot, not looking for you to speak to others, but based on a story from a few years ago, I think we have about, at least as of 2020-2021, about 55,000 dog licenses. I'm guessing we're about the same today, if not more. I'm going to ask our city staff. If we wanted to continue on with what we did last year, 150,000 in a $3.5 billion budget doesn't sound like a lot, but anything we're increasing does go on taxes, unless, and here's the question, for an extra $3 a year on the dog license fee, that covers the cost of this. And assuming that is still about the same number of licenses we have, what do you think? You will, is that something you'd be willing to do? Is that something you think, is that a worthwhile cost if that meant we can do that? I heard a lot of support on my Facebook page when I asked it, but I'm curious as to other folks' reactions.
$3, absolutely.
I see a nodding head from you as well, Andrew. Perfect. Okay, yeah. I only ask just because truly looking for creative ways. I'm going to double check if my math is right with our city administration, but that is potentially a way to start getting this off the ground at least right away. And then I do think there's an argument that you don't want to only rely on fees to pay for something like this going forward. There's a broader community benefit, and property taxes should cover for things in a broader community benefit. But we're just looking at really tight times. So I've been trying to think of ways to do it without having to ask for property taxes in this year. So appreciate your answer. And those are all my questions. I'll have some questions of them in. Thank you.
Thank you, Councillor Knack. Councillor Rutherford.
Yeah, thank you to both of the speakers for being here today. In full transparency, I did not support the pop-up dog park. And I didn't support the pop-up dog park when this came because I worried it would set up a false sense of expectation without any budget to actually see it through. And to me, that the data shows that. And another thing I've been really struggling with is we already have dog parks in existence that could be better serviced, be it more accessible, be it with permanent watering facilities, be it with many other things that could enhance them. So I struggle with this balance between, even if we do something like increase, let's say, dog license fees, which I know is something Councillor Knack is exploring, what is the cost benefit of enhancing what we already have versus expanding out in an unsustainable way? Any thoughts on that?
Can I comment on that?
Yeah, that's for both of you, for both the speakers.
Okay, thank you. So I hear what you're saying, and I think there are some great large dog parks in the city, but as the other speaker noted, they're not necessarily easy to get to. And in particular, I think in the late fall or the winter, when it's dark late in the morning and early in the afternoon, they're not going to be easy places for many people to be, I think. One of the benefits that I saw of our neighborhood pop-up park was that it was right in the neighborhood. It was small and it was already a lit area, a relatively lit area, because it was close to sidewalks and things like that. So it wasn't something that made it challenging or difficult to be at very early in the morning or sort of late in the evening. And you knew other people were going to be there. I think the issue of accessibility is a big one.
Yeah, and I guess to follow that up, like when you heard the presentation from administration where they said that there's the opportunity for community-led, like would that be something that either of you would be willing to, like if this funding, if we don't move forward with this permanently at this point, would either of you through this experience consider a community-led project?
I would, or find a way to continue to work with this, definitely.
Kevin?
That's not something I've ever been a part of or honestly considered. I do know that our Horizon community group or league has been in touch with the city pursuing something along that lines. I only just interacted with them on Friday, so that's not something I've explored very far, but I feel like most dog owners are willing to do just about anything if that means getting something closer to them to make it easier to be a good dog owner.
And can you clarify for both of you, were the two locations near your places of residence or were that you utilized fenced or unfenced? Because I know not all of the dog parks were fenced.
Mine was fenced.
Mine was fenced as well, and that's something, going back to the comment about how there are already a number of large off-leash areas. It's pretty unnerving at the darkest times of winter when you're getting off work at 5 and it's already pitch black. When I go to Jackie Parker Park, there's really no one there. You can hear coyotes. I don't really like taking my dogs there at those times. It would be so nice if I could just walk down the road to a community park where I know that there's a fence protecting us. We're in a community. It does feel a lot more safe when you're in a community off-leash area.
No, great for that context. I appreciate it. Those are all my questions, Madam Chair.
Thank you, Councillor Rutherford. Councillor Wright?
Hi, thank you. I think you both answered Councillor Knack's question as far as increasing fees by $3. Because it's not something that we consider to be a core service in Edmonton, and some of the work that's underway right now is to reallocate money for core services. Being two dog owners would, and not speaking for the whole community, would you consider a higher fee sort of as a user pay type, not only to maybe improve the existing parks, but for those in developing areas not to have to wait as long as you have? Like, what would be sort of the level that you would consider to be unaffordable?
Sorry, you mean for increasing the fees?
Right, yeah. So right now for spayed or neutered dog, it's $37 a year.
It's difficult for me to speak other than just for myself, but if you told me it was going to be $45 or $50, I would pay that.
Okay.
Like I said, not
there,
everyone would.
Yeah, and there's reduced fees for incomes or those on income assistance as well. Andrea, what would be reasonable for you?
Yeah, I would say similar. I think it would probably also be helpful for people to know what those fees were going to, right? I think if people knew that this was part of the fee, it would also put it in a different light.
Okay. All right. Good. Yeah. So maybe a bit more communication on the city's part as well. Okay. Thank you. That's all I have.
Thank you, Councillor Wright. That looks like that's it for questions to our speakers. So thank you very much for being here today. Next, we will go to questions of administration. Councillor Knack, you selected this item. You can go ahead.
Yeah, thank you. And thanks so much for the report, but just actually thank you for the work to even do this. I know, maybe I'll speak to it when it comes to speaking to it instead of doing it now. So let me ask questions, which is, how many, you heard sort of my suggestion about dog license fees. Can I ask first, how many dog licenses do we have now? What's our current number at approximately? Is it around that 55,000 mark?
Hi, Councillor. This is John Wilson with the Community Standards and Neighbourhoods Branch. Thank you very much for the question. So currently, as of January of this year, we have 54,440 dog licenses.
Okay. So, I guess then the question to whoever is, and we can nitpick the dollars, but around $3, $5, something like that gets you the ability to maybe fund most of what we did, I wouldn't want to be very specific. I would want to say increase the fee by X number of dollars, and then you as the experts go and use that funding to create a combination of new dog parks, maybe enhance existing, but essentially use that for dog parks. And so, is there any reason we shouldn't consider an option like that?
The one caution I would share, Councillor, is that increasing licensing fees can become a barrier to people actually licensing their pets.
Yeah.
And when we deal with unlicensed pets, of course, reunifying people can be very challenging. And that is ultimately our goal of the licensing program, is to reunify lost and stray pets with their owners so they get back home as soon as possible. And we do find that licensing fees can be a barrier to that reunification, and increasing licensing fees can have a depressing effect on the licensing rates.
Perfect.
So yeah. I would share that one caution.
And as well, maybe just to add to that, I think and I know Harm's online too, but we've talked about in budget and leading into SOBA about structural issues in our budgets. My understanding is that the pet licensing fees have been funded or not meeting their budget targets for probably the past 5 years, and I think it's to the tune of about $900,000 in the budget. So one of the structural issues that we have to have a conversation with, obviously, as we go through SOBA, but that would be another barrier as well.
Okay, and the good flags, and so I guess I'm thinking about Calgary's fee is $44 for a neutered or spayed dog, if I'm correct, if I'm reading their site correctly. Does that sound familiar? I don't know if you've done a jurisdictional scan. I'm just thinking about, what would be that sort of magic number? I get you probably wouldn't want to go up to like, $50 or $60, but if you went from the 37 we're at now to even like what Calgary's doing, does that give you some funding to start doing that, and B, maybe start to make up some of the structural deficits? If there is, that structural deficit, we have to make that up one way or another as well.
Yeah, there is a difference between the fees that we charge in Calgary, and you're quite right, Councillor. We charge We charge $37 for a spayed and neutered dog, as opposed to Calgary, which charges $44. However, we do charge $77 for an unspayed or neutered animal, whereas Calgary charges $70. So there are some differences in terms of that rate. And one thing we wouldn't want to do would be to increase the rate for unspayed and unneutered animals, because that would discourage responsible pet ownership, because we do encourage people to spay and neuter their animals. So we wouldn't want to create a disincentive for people to do that.
Okay. So I guess, to be very direct, if we don't do this, we're not going to raise property taxes for this right now. I'm pretty sure that's council's perspective. We've been very clear. So I'm thinking of making a motion, and so I've heard some caution, but I haven't heard necessarily you think that's a bad idea. You just want to be aware of there's a bit of a structural deficit. There's some of these other pieces you don't want to get it too high. So if I were to make that motion, I guess I'm looking for your best advice. Is if I want to continue it, this feels like the only way to fund it outside of property taxes. Thoughts is if do you not want that motion, or do you feel that's a reasonable motion while still flagging what you flagged for caution?
And I think Harm is online. That could probably speak to.
Yeah, I am. So Councillor Knack, I think like Eddie kind of alluded to there, there's a pretty significant, I would say, structural deficit around $800,000, $900,000 a year. So I think if we're considering increasing the licensing fee here, I think one thing you might want to consider is kind of truing up that budget first. So considering that a first priority before funding new services or new programs. So that's the one word of caution or advice I would give.
Okay, I'm out of time. I might have to come back around. Thank you.
Thank you. Councillor Rice?
Thank you very much. And then I want to say thank you for all the reports. The reports have provided lots of good information and very comprehensive. Thank you very much. So my first question is about, and then in the report, this identified is long call services. Can you explain the specific reason behind this? Why it's considered as a long call service and from our city?
I think that when we went through the budget, we identified which core services were and which non-core services were. So core services were things like snow and ice clearing, emergency services, things like that. And this definitely, when we went through the scan of services that we've had, fell into the non-core service category. So things that needed to get done, grass cutting, trimming, things like that, these are would be considered on the nice to have side of it.
Is this fall under the community well-being and category? And because right now community well-being and is our city's core services considered based on the budget process, and would this could be under that? And because this is related to people's quality of the life and how we people live in our neighborhoods.
Yeah, I'm not sure if we're looking to kind of redefine what core and non-core was. I think we went through that process during the budget time, and it was identified as a non-core service through the council sessions. So,
okay, so then my next question related to if it's a long-core services in 2023, and how many locations our city provided for this pop-up dogs, and also what's the budget? And I know we didn't have additional budget for that, but what's the spending, actual spending on these pop-up dogs and in 2023?
Yeah, I think I can turn that over to Mark or Craig.
Yeah, I can answer. So the program was launched as up to 30. And so then there was a scan in different across the city to look at walking distances and what are the appropriate neighborhoods, and also in a lot of engagement with Edmontonians. So the short answer is 19 different pop-up dog parks were put in place throughout this past summer. And then the actuals was just over $330,000 expended in 2023.
Okay, thank you very much for that information. And also the for 2023, the pop-up dogs is seasonal and is not year-round, right?
Yeah, the pilot was seasonal. So it was, and then so there's there's options in the report in one of the attachments in terms of making it year round, which comes with snow and ice clearing considerations and things like that as well.
So that is my next related question, and then is subsequently question. And because right now for the financial consideration, you provided two different options. One is seasonal, and one is year round. And the seasonal, and then definitely costs less. And also under each category, you have the different locations. Last year we actually had 19 locations. So this year you present about 20 locations, 40 locations. So I just have one question related to locations. By looking at the map, is attachment to attachment and provided the maps and it's specific to locate it and permanent and future possible, and then the proposal one. What criteria did you use to identify? Because I noticed in the newer development area and specifically for the faster growing south area, they're not in the map, then it's indicated they're not enough compared to the other areas in the city and for the Popup Dog Park. So can you tell me and how you identify the locations to rebalance that leads across entire city? Sorry.
Yeah, you bet. A whole set of criteria were used, but in general, the existing dog parks and like the walking distance, so a 15-minute walking distance, the amount of pet licenses in the area, but also population. We know that roughly 35% of people are registering their dogs, so a combination of both dog licenses and population was used to figure out, the demand. And then approximate location, walking distances, and then looking at the map very specifically to look at the pieces of grass. Where could they go and adjacent land use, considering, where there's highways, arterial roads, playgrounds, different things like that. So if there was any sort of adjacent land use issues and trying to figure out the amount of space, would it need to be fenced? So there's quite a host of factors that were considered when looking for the particular areas that were picked.
I may come back for follow-up questions. Thank you.
I'll also say the engagement was also very much a factor.
Thank you, Councillor Rice. I do have a question as well. I know that I had actually brought this idea forward it was probably about a year ago, maybe 2 years ago, the idea of increasing the fees in order to go towards providing these services. And at that time, administration did recommend against that because of the things that you outlined today. And I do believe that you said you did do a jurisdictional scan with other municipalities across Canada. Is that right? I recall seeing one.
Yes, that's correct, Councillor.
Okay, thanks. And you, Mr. McEwen, you said that 35% of the pets are licensed. Was that correct?
Yeah, that is that's the most recent data that we have from our community standards team. That it's, I believe, about 35% of the estimated amount of dogs in Edmonton are currently registered. But John, you can feel free to jump in and fact check me.
Yeah, absolutely. Yeah, that includes both dog and cat licenses.
Right.
It's about between 34 and 35% currently. And we have been seeing a downward trend in our licensing numbers since about 2018, when a previous program and service review recommended that we stop having peace officers do delinquent licensing enforcement. And so we have seen that outcome from that decision. But I am happy to share that with the investment the council gave us in new FTE for animal control peace officers, we did revive that program last year, and we're already seeing some promising results.
Okay, great. You were anticipating my question. That's great. So, and that I was going to follow up on the enforcement. If we were to say fund the enforcement option that was presented, would that result in any kind of revenue?
There would likely be some revenue, but I would suggest it may be negligible. The biggest benefits, I think, from a citizen's perspective are going to be that they would see regularly more uniformed peace officers visible in the off-leash parks, which I know is something that our residents have told us they're looking for. And it does allow us to be a lot more proactive in our enforcement. But that also allows us to do a lot more education and a lot more engagement with the public, so we can advise them of what the rules are, how to be responsible in their use of off-leash areas. And that's really one of the main focuses of providing that proactive enforcement. We do still, of course, enforce the animal licensing control bylaw and other legislation. But where we're not doing it proactively, we do it in a complaint basis after the fact.
Okay, yeah, I was going to ask if we are enforcing proactively, or is it strictly on complaint?
No, it's not.
No, because of the new, okay, great.
Yeah, because of the new officers, exactly. We actually have an off-leash parks proactive patrol program that's launching in this spring. And that will see 4 officers doing vehicle, foot, and bicycle patrols in our off-leash parks. There'll be 4 officers daily, 7 days a week, providing that proactive enforcement.
Excellent. Thank you very much for that. Next, I'll go to Councillor Paquette. Please go ahead.
Oh, thank you, Madam Chair. Yeah, just a quick question about the concern about increasing licensing fees. Do we have an idea of the elasticity of buy-in for every dollar increase or what have you?
I don't think we have anything quite that formulaic, Councillor.
Okay.
But speaking anecdotally and looking at the sort of larger trends over time, I can say that we have one of the most expensive fees for dogs, especially unneutered, unspayed dogs in Alberta when we compare ourselves to other municipalities. And as I mentioned earlier, we have seen that trend in the last 5 years where our licensing rates are declining. And so I can speak anecdotally to that being the trend that we're experiencing. And we do know that the cost of a license becomes a barrier, and licensing an animal is so important in ensuring we can reunify lost pets with their owners, that sometimes having fines for not being licensed becomes a reason for people not to come to the Animal Care and Control Center and pick up that animal that maybe got out because they couldn't afford or chose not to get a license.
Okay, so, all right, so this is anecdotal, but we don't have the data. But, and then the next question, I guess, would be, do we know if there's been an increase, decrease, or remain relatively static in terms of pet ownership over the past 5 years where you say licensing has actually decreased?
Yes, pet ownership has definitely gone up. There are some general trends and formulas that we can look at with respect to the relationship between pet ownership and population increase. And certainly we've seen population increase. And so I think it's reasonable, and we have done some research in this area back in 2021 around estimated pet populations. And that's what enables us to say that we estimate right now we're licensing about 35% of our cat and dog population in the city.
Okay, so we're stuck with this question of if we charge more, there may be more people opting out of licensing. Does that negate the increase as far as money? Because we have a structural deficit that we have to take care of. So do we have any thoughts on that, a formula that would let us know what we can expect if we increase fees? Are we going to actually get increased dollars in order to provide for these structural deficits or not? That's the big question I've got.
I think it's fair to say, and I'd ask my friends from Finance Harm to help answer that question, Councillor, but I think it's fair to say that providing the services we do around animal welfare is not a cost recovery service. And already with our decrease in licensing rates that we've seen, we are not achieving anywhere near our revenue goals. So I don't think we would see any sort of offset that would enable us to recoup the costs of providing those services.
Right.
Yeah, right.
Well,
and deflection in the costs is definitely something, Councillor, that you're absolutely correct. As soon as you raise the price, there's going to be an elasticity deflection of folks that won't pay. Very similar to the way you deal with transit ridership and ridership deflection on fare increases. The same rule applies to pet licenses, and there are calculations that we can make on elasticity to find out, how much we would actually recover. Obviously, we have about $900,000 deficit in that program right now, and raising it by $3 would indicate, if it's a straight number, about $162,000 of recovery of that $900,000, but still quite a ways away from the full breadth.
Right. Okay. And so, yeah, at some point you reach diminishing returns. I get that. Now, the other question is, can we actually dedicate licensing fees to specific infrastructure and operating endeavors?
We'll toss that one over to Harm.
Hi, Councillor. So I think when the animal care program is established, there's some we try to determine what the subsidization rate is, and I don't know what that is off the top of my head, but how much would be funded through tax levy and how much could be funded through other non-tax levy revenues like licensing costs specific to the animal care program. So when we set this up, we landed on a ratio, and we've fallen short of that. So if the rates are increased or if the license fees are increased, I think you could have them fund the animal care program. They could be directed towards that program. Yes.
Okay, I see. I don't know if I've been helpful or not in this conversation. Thanks, Madam Chair.
Thank you, Councillor Paquette. Councillor Rutherford?
Yeah, I'm sticking away. I have a lot of questions about the fees, but I'm waiting for a motion to be put on the floor potentially about that to ask those questions. So I'm going to focus on the report. And one of the things I thought it was interesting is that within the report, it didn't mention actually a few stuff that I already know exist in the ward I represent that are happening around dog parks. So I'm wondering if it's actually as comprehensive. And I'll give you a few examples. The EPCOR Lauderdale, it's a flood mitigation plan, but they're going to do a lot of enhancements to that dog park. The Dunluce neighborhood renewal is enhancing the dog park along 127th Street. And Canada Lands is committed to a dog park in the new northeast corner of Griesbaugh as part of that recently approved neighborhood structure plan. But none of those were mentioned in the report. So I'm just wondering, it makes me question how comprehensive that is in a full scope of what is actually still to come around dog parks. Thoughts? And that's just for my ward. I don't know if that's an anomaly or what, but.
I can start, and then I'll see if Mark and team have additional input. But I would say you're absolutely right. There's more enhancement and enhancing projects. There's multiple different avenues for a pop-up dog park or enhancements to capital projects beyond than the details of we were provided in this report.
Okay, and I'll just add that our focus on this report was really on the off-leash program itself and the pop-up dog park program, not necessarily on the growth projects that are going on or the enhancement projects that were going on across the organization.
Yeah, but I think if we're going to talk about potentially a motion or continuing with permanent for the pop-ups, it's also important context to see what is actually already in the works from enhancements perspective. I guess my question, Mr. Wilbur, and I'll put this one to you, is what would be your priorities operationally, specifically on the dogs and open spaces file?
I would probably pose that one to Mark, but I think as far as, and I'll let him answer that. But as far as overall priorities for city operations, obviously we're focused on delivering what council endeavors to label as a priority. And lately that has been looking and concentrating on core service delivery, and this one didn't fall into that category. So, but as far as the program itself, I'll let Mark give you the details of the program itself.
So the goal of the program is to increase accessibility of off-leash areas based on where the need is. And in the report, there is a heat map that shows where the demand is and where the existing locations are. And we've identified areas that are of the greatest need, where the most dog owners are, and the least amount of access in close reasonable proximity, which we've defined as 15 minutes walk, based on the district model of having access to those off-leash areas. So this is a way that we were able to bring in a pop-up program and kind of bridge that gap, get some really timely, insightful feedback on how that was received in the community, and then that would help shape the future strategy for where we're going to be investing our permanent infrastructure for off-leash areas.
Okay, and then just on that question, because not all dog parks that were in the pop-up program received fencing. When you received feedback from the various areas where there was the pop-up dog parks, what was the difference in reception of feedback between the areas that were fenced and the areas that were non-fenced? And I'm thinking specifically of Carleton, which I actually got a lot of negative feedback about that dog park.
So in the recommendations of the 9, one was unfenced. From going out and looking at them, there are a lot of things that need to be right in order for a green space to be.
I'm just asking about from public perception, from the ones at the pop-up dog parks, was there a more positive response to fenced dog parks than unfenced dog parks?
Much more positive fenced, because that's a defined area, and it also keeps the off-leash area contained and opens up that green space for alternative uses outside of that fenced area.
Okay, sorry, I should have been more clear with my question with that last one. Apologize. Thank you so much.
Thank you, Councillor Rutherford. Councillor Jans?
I was just wondering about any kind of counter data we had on the dog parks, or was it all anecdotal?
No, we have specific data. We were sending out members of the team to both use counters and visually interact and discuss with people who are using the park, as well as we had some passive counters as well that gave usage. The one caveat there is that it didn't differentiate between human and dogs, so it was just overall users for that space.
Yeah, well, that's fine, I guess. Overall, I mean, love it, love the program, love the work. I think I've made that abundantly clear. I kind of defer to my colleagues here, since none of these parks are now in my ward, but I certainly am supportive of them writ large for the city. So they will know the local context better. I guess the one thing that I was a little curious about was the $132,000 for an animal control officer vehicle. I mean, that just seemed a little steep. I was wondering if you could help me unpack that.
Yes, I can speak to that, Councillor. And yes, on the face of it, it does seem like a large amount of money for a vehicle. One of the things I'll point out, though, is that these vehicles actually include heated and cooled air-conditioned units for animals, so that animals can be transported safely. And the vehicles have to be quite large to accommodate each of these units. And also the operation requires vehicles with four-wheel drive, so they can access off-road spaces such as parkland and off-leash parks. And of course, the equipment that is required for an animal control officer to deliver that service is quite substantial. And so all in all, these vehicles fit a specific type, and they are expensive.
Okay. All right. Well, that makes more sense. If it's, fully loaded, equipment included, that would help. In general, I guess by way of feedback, so I don't have to speak to it, I'm fine with an increased pet fee. I'm fine with, as a pet owner, it pales in comparison to what I'm paying for pet insurance and the shrinkflation of the kibble these days. It seems like, 100 pounds isn't what it used to be anymore.
Point of order.
Yes.
I actually have another question, though.
Sure, but can I, to the chair, can I say my point of order?
Yes, please go ahead, Councillor Rutherford.
There's no motion on the floor at all in which to speak to. So I just want to be clear for the public.
My mistake. What I was wondering, though, when it comes to pet registrations, I know it had been floated, and I'm not sure if this was a previous Reimagine report recommendation or something, but was there a contemplation of a lifetime pet fee so we wouldn't have to go through all the administrivia and sort of the annualizing of the pet renewals and all that stuff?
Yeah, we have explored that concept previously. Currently, we offer 1 and 2 year licensing options. What we found when we did our research on the lifetime option was that it's a problem because people frequently move, and when they do, their license records are often not updated. So offering a lifetime license might offer some small savings to licensees, but what it does is it creates a situation where we often find, or rather jurisdictions that have used them often find, that people have moved and they haven't updated their license information. And this makes it very challenging to reunite the pet once it's lost with its owner. And so given that that's our driving goal with pet licensing, it became a reason for us to look at that and say, maybe not the best choice.
Okay, so it's about good data hygiene as much as anything. That makes sense. And finally, I think when we started talking about dog parks, admin was saying something like they would cost around $450,000 per park, and now it seems like they've gone down quite a bit in cost. So I just wanted to say I appreciate it. It looks like we're trying to find ways to do this much more cost effectively. That's all I have.
Okay. All done? Thank you.
Yeah,
Councillor.
thank you.
Okay, thank you, Councillor Jans. Councillor Stevenson, please go ahead.
Yes, thank you very much. Thanks for the report, the conversation today. Just a few technical questions, I guess. So just, I think I heard a couple of different things. Just want to clarify from my understanding. So when we're measuring demand, I think the factors that were mentioned were dog licenses, 311 calls, or population. So just wondering again how those factors were weighted. So let's say you had a neighborhood that had a lot of dog licenses, a high population, but just not many 311 calls. How does that balance out to maybe a lower population area with not as many dog licenses, but lots of 311 calls?
Yeah, I can get started on that. So the demand, it was a demand on off-leash area had both like the human population and the dog license ratio for a given neighborhood. So we took into account human population per dog license ratio and then categorized that into different buckets of low, medium, high, and incorporated that with dog license numbers, having different ratios. And then in addition to that, distances to dog parks. So a low distance would be, less than 1.2 kilometers, medium, high, and then put all that together to try to build demand into the graph and the different shades of color that were in the map on the report.
Okay, I appreciate that. Yeah, I think I'm always very spatial and just kind of looking at, some of the areas I represent, which are, some of the highest density neighborhoods, the ones that have the fewest sort of access to private yards. So happy to follow up on that a little bit further offline. Just in terms of, and I apologize, because I'm getting myself mixed up. So there are some other initiatives. I'm thinking of the formerly the Oliver Community League, the Wequentawin Community League with their pop-up, what I thought was a pop-up park, but I think it wasn't a pop-up dog park on 118th Street. So those are apart from this program?
That's correct. The Wequentawin is one that is operated by that community league.
Okay, so it's more like a community initiated. So that was another clarification I wanted. So the community initiated option, that's on licensed land only, not other park space?
Typically, and Becky can add some color onto this, but typically it is easier to do it on licensed land that the community league would have access to, but there are possible other options based on that ongoing discussion.
Okay, great. And then just in terms of some of the existing dog parks, so, appreciate the point raised in terms of enhancing what we already have. I know, for example, Grad's Park in my ward, I know there are some challenges in terms of it not having fencing, conflicts with a nearby playground. So with is there any funding for that right now in terms of capital maintenance or through neighborhood renewal, anything like that?
I believe we have colleagues on the line from Integrated Infrastructure Services, but to my understanding, the capital that is associated with the ongoing enhancements to existing off-leash areas lies within their capital profile.
Okay, if there's anyone online that could speak to the availability of that resource or what that looks like, I think I can also follow up offline if needed. Then maybe just a clarification as well. So for some of the cost options, there was a one-time $125K cost for the, this is for the temporary and seasonal dog parks. Just wondering what that one-time funding is in 2024?
Yeah, what one-time funding is largely to build, it's around public communications and public engagement. So having a person in to help build that plan, we found a large part of the success with this program this past year was the amount of engagement. Like we mentioned in the presentation, there was close to 150,000 residences with postcards put out, a lot of in-person engagement. So this 125 grand would really be focused on that communications expert to help us with that strategic communications plan, marketing plan, and build out that public engagement work.
But it seems like the location's already selected. So would it be, maybe I'm sorry, I guess I'll have to come around on that, but thank you. Thanks for that.
Thank you, Councillor Stevenson. Councillor Hamilton?
Yes, thank you. I just had one question. So it sounds like from the discussion, maybe this is more of a comment to start, that we might need a bit more of a comprehensive sort of sense of what's happening in the dog park space, because I'm hearing that a lot of my colleagues might be have questions about the other programs to sort of flesh out our understanding of what's happening with the dog park programs across the city. But my question really relates to some of the sites have been identified as not having of essentially discontinuing the Popup dog park program. And I'm wondering if that means that there could or would be future activations on the sites, or if you're going to keep that sort of that engagement in mind for future activations, whether or not it's part of a Popup program or part of the other dog park, the suite of dog park program offerings.
I can jump in on that one. So based on the assessment that we've done in the phase 1 and phase 2 what we heard reports, and we published the phase 2 what we heard report based on the evaluation of how the 19 sites went and the feedback that we got, that we wouldn't explore future activation on those other sites based on the feedback that we got. We highlighted the 9 that were like the highest demand and kind of that universal endorsement of off-leash area in that community. And then if we were going to explore other ones outside of that, then there was obviously some barriers in there that residents let us know about.
Okay, thank you. That's helpful, because I think certainly in some communities there was a little bit of anxiety about the potential for future activations if it was overwhelmingly requested that they don't continue with the pop-up program in that neighborhood. Another question I had was there were communities that wanted to be part of the pop-up program. And forgive me if I missed this as I was listening on YouTube, but is there an opportunity? What are the next opportunities for communities who want to be part of the program to plug into this?
We do have the rink program, so that is one of the options. But I'm going to just ask one of the reps from our team to jump in on the other available options for community-led programs.
Yeah, I guess we gave the report in January on the community group led options for adding on an off leash area. I think that our focus for this report was on evaluating the 19 that we did for Popup and which ones were deemed to be the most successful, and then the 9 that we identified through there. There's obviously options for community group led construction for any site even not included in here, but that was the focus, was these 19 in the pop-up program. But if there's anything specific from a community, I'm happy to connect with your office offline and work towards getting that group connected with the community group led construction process.
Sure, and that's really helpful, and I'll certainly take you up on that. I think maybe some of the there were. I think there's still probably demand from communities to be part of the pop-up program. There's certainly a lot that don't have access to a rink space. So that's, I guess I'm looking sort of what the opportunities for expansion may be, but it sounds like you're really focusing on the sort of evaluation of the program to date and not opportunities for expansion. Is that correct?
And maybe I can jump in. I mean, the program itself, the pop-up program that we did here was a temporary pilot program, and we are basically sunsetting this program if there's no other budget to kind of do this work. So for those folks that are looking, as far as expansion goes, I mean, really just continuing the program would require an investment of budget by council, and then if this becomes an ongoing program that we keep in perpetuity, then we would look at something of how we manage that program in the future. But right now, it's more about how do we fund it now.
Perfect. Thank you. And that's my time.
Thank you, Councillor Hamilton. Councillor Knack.
Thanks, Councillor Principe. So I just want to make sure before I do any motion, because if this is just received for information, not only do we not do any pop-up parks or anything permanent or temporary, we still have a $800,000 structural deficit, is what I've heard, correct?
That is correct.
So what would happen with that if we took no action today? What happens? We just continue to make that up through the existing property taxes, which is, I'm guessing, how we've done it the last number of years?
That is correct.
Okay.
So just to step in there for a second. So
please,
the way that's currently working is, so when you set the budget, you had approved in there certain license revenues and tax levy for the animal care program. And so that's what the budget reflects right now. So annually, when we're falling short of those revenue targets, the dog license revenue targets, it's essentially falling as a part of your tax supported deficit or your tax supported position and funded through the FSR. So that's what's happening on an annual basis right now, because we haven't been able to correct it through some long-term sustainable funding source, such as tax levy or increase in licensing revenues.
So that leads to that question, because this is a bad way to be doing things, right? Like we don't want to consistently run a deficit and not actually take action. So I guess my question is, I think what I'm hearing is that you'd like that to be addressed. I don't know if we should probably be doing that all through fees. I think there is an argument to be made through a distribution of taxes and fees. But originally I was thinking $3, but if I'm hearing you need more than that to be able to start addressing this deficit, like I'm trying to figure, I don't want to necessarily pick a number out of the hat here, but I also want to begin to give you some type of ability to address this. So do you have any recommendations of where we might start? I'm leaning more towards the idea of saying, okay, instead of $37 a year, it's going to be $45, an $8 a year increase, which still probably wouldn't solve the entire deficit from what I'm hearing, but might get us starting down a path and hopefully still allow us some money to do the dog parks.
Yeah, and I hate to do this kind of thing through, here's the gap and what does that dollar figure look like to close the gap? And technically these situations you want to be kind of programmed around the deflection of of those who pay pet license fees, and what does that mean, and how much will you actually recover? If we say $8, it doesn't mean you're going to get, $462. If you get, or $3 doesn't mean you're going to get $162. It's not a straight linear relationship. So, knowing where that fits, and I as well jurisdictionally where we would fit across other municipalities and cities would be of interest to me. So making sure that if you're looking for a number, that number is adequate and lines up with where industry is.
Can I ask, here's my tough follow-up. I feel like, we've talked about this not being a core service. So if the direction today is go do another report on something that you already feel is not a core service, to go determine something that feels frankly like a bit of a waste of your time, being that you've told us in the report that's not a core service. Is it better, I've heard from Mr. Wilson that we're going to be we have more enforcement officers to try to make sure people are registering. The 54,000 we're at now seems to have been steady over the last number of years. Is it better for us to do something, I guess, versus asking you to go, that could be another 3-6 months of a report that feels really like an ineffective use of everyone's time.
And I think that is always council's purview to choose. So we can only identify the challenges that go along with that and the risks that go along with that conversation. If council chooses a number that they wish to increase a pet license fee by without having a report, or what we would provide as a kind of a response to that, then that is always in council's domain. Yeah,
I'm just trying to figure out, how quickly do we want to address something that has sounded like it's been a problem now for a number of years, and so. Okay, I'm gonna think a little bit more, since I see a couple of people on the board, before I put forward a motion here. Thank you.
Thank you, Councillor Knack. Councillor Rice.
Thank you, Chair Principe. Very good questions. I do have some follow-up question regarding the financial consideration. So because in 2023, and for that pilot project, and we did 19 locations, and the actual spending is $330,000. That including public engagement, including maintenance, and including operations. So is there any possibility we stay that status quo and to do the same thing? Because we heard lots of positive feedback, and in terms of last year's pilot project. So I just want to ask, is that possible there?
Yeah, I think to answer that, and this might be able to answer Councillor Stevenson's question at the same time about the dollar figures. So there was about $330,000 spent on it. It was the first time bringing it up to speed. There was a lot of staffing, planning, public engagement, in addition to the infrastructure and the ongoing operations and maintenance of the work and evaluating it. So looking for all the different cost efficiencies we could find, but incorporating the feedback and trying to figure out how do we adjust the program to consider all how do we consider all the feedback and adjust the program and then communicate out the changes. There's 9 parks we think we'd be able to keep going easily that had high usage and were generally good feedback, high percentages of feedback. I believe the 2 speakers, the percentage of positive feedback in those communities was close to 80% in both of those particular neighborhoods. So we would still have to plan in terms of how do we want to communicate with the neighborhoods and the communities, adjust given the feedback that but then also at the same time incorporate the cost saving measures by leveraging all of the pilot program's work. So that's what led to the cost estimates in attachment 6.
Yes, I understand. I also appreciate that spirit of enhancement, and then but it gives them so many factors, questions, answers I heard here, and for this is not under that category of the core services priorities. And then if we could do last year, and then my question is very simple. If we could last year and use $300,000 or over $300,000 and for the 19 locations, and that is seasonal, is not year round. And then is that possible? We could do the same thing, and at the same time, at least to meet the community needs and for those access and to the pop-up dog parks, and then without do any extension or any more work, and still keep the same work, and then keep based on the feedback we received, and then people, community still happy for those services be provided, instead of we cut them all, or we only move the land sites here, because financial consideration you provided here for the land sites, and then even for the capital piece, and it will be cost like 642,000. So I don't know where is that money could from, and from funding source perspective. And we are talking about the option to provide support for the operation. So operation, of course, is going down, but the capital is going up so much here. So that is what I'm thinking. But I'm willing to help my to hear my colleagues put some motion and to have different options to be explored. But the key point here is because we only have limited two options: either increase taxes or either increase the fee, license fee. And which one could be acceptable by the public? At the same time, they have to keep the same level access, not even decrease from last year, and for the community to have that program in the neighborhoods.
The only thing I would add to that, Councillor Rice, is the $330,000 that I referenced there is no budget for that. So that was unbudgeted. So that was spent out of variance. So that budget does not exist.
We still need additional budget.
In order to keep the program going, there would need to be budget to fund it, unless there was direction to proceed. I don't know if that can be done, but there is no money, so there's no budget.
There is no money for that. Okay, so I will stop here and to hear my colleagues more ideas, discussions.
Thank you, Councillor Rice. Councillor Stevenson?
Yes, thank you. Just following up from that question. So $125,000 in public engagement. Again, recognizing that some of the spots have already been identified, what type of engagement what would the focus be of the engagement?
Yeah, it would largely be to incorporate the changes. It's not just the engagement, but it would be have a person to help with the planning. So planning in the different sites, incorporating the feedback, and helping run the program. But a large portion of that is that community effort, that engagement effort, and coordinating all the different responses, the feedback, incorporating the changes into the program, and developing that communications plan and strategy for any sort of changes or new sites. It was a very high touch program. It's a very polarized topic. Lots of people either really love them or really don't. And so then there was a lot of ongoing dialogue back and forth with the community in this topic.
Okay, great. And then just want to clarify my understanding. So there are 4 new enforcement officers that are going to be coming online this year?
We actually got an increase of 22 animal control peace officers during the 2022 4-year operational budget cycle. And so we have hired those officers in 2023. They've been trained through peace officer training, and we developed the programs that they will be delivering. And so they are already deployed, and many of those programs are already in place, but haven't been completely powered up yet. We're having some official launches for the proactive off-leash pass patrol program in the spring of this year.
Okay, so I'm assuming the proactive off-leash patrol would result in, potentially identifying pets that don't have licenses, which would help with this issue of getting more people registered. Would the work of any of those other 22 positions support licensing capture?
Absolutely. Having a dedicated license team won't preclude our other officers from dealing with license issues that they come across incidentally in their other work.
Okay. So it seems like, appreciate that risk. If we're increasing fees, we might see more delinquency, but it seems like we also have those enforcement resources coming in as well. Then, if council were to provide a pool of funding potentially through increased licensing fees, how would your teams determine? So what I struggle with is sort of that, the capital versus the operating investment. So to me, it sort of seems like overall we seem to get better return on our investment with permanent sites, just that lower ongoing operating cost. But again, there's that upfront capital. So just wondering how your teams would balance that or make an assessment about which approach to take.
I think how we would tackle it, and I'll hand it to Mark as well to add some to details, is I think it kind of depends on the amount and the number. So like on attachment 6, if we wanted to convert 9 sites, there's close to $650,000 of capital required. But if we wanted to do 10 on an ongoing seasonal basis, temporary fencing is, that ongoing rental cost. And it's not as like it doesn't look as good. The neighborhoods have told us that it doesn't look as nice. They want permanent fencing. So we can stretch out that operating dollars longer, but it costs more on a regular basis, whereas that upfront capital cost. So I think we would be open to whatever direction we're looking at, is concentrate it knowing that we would need the upfront capital, or stretch it out if it were to be remaining in operating and temporary.
Yeah,
that's right. The temporary fencing for 6 months is, on average, each site would vary a little bit in size, but averaged a little over $7,000 for 6 months. Whereas the estimate that we provided in the report is about $80,000 for capital for aesthetically pleasing black chain link fence that the community would be able to provide input on what that look and feel is for that community.
Okay, great. Thank you. Yeah, I think those were all of my questions. I think, looking at fee options is a neat approach, but I'll leave it to my committee colleagues. Thank you.
Councillor Paquette, please go ahead.
Yeah, thank you. So give or take about $1 million. What Councillor Knack is probably proposing gets us about halfway there. The other half would come from the tax levy. Is this your understanding too?
Yeah, I think it would be about halfway. But however, I think the big portion of this kind of is council can decide how to deal with that other half. So I think, I'd leave it to Harm to kind of jump in here, but that other half would have to be tax levied out, or we continue to carry that variance that we have for the past 5 years.
Right, which we could. So I guess the question is, what is optimal? What gets us the most results for the least amount of dollars?
I think coming from administration, optimal, and not to speak for Harm either, but I think dealing with our structural problems and getting ourselves back to zero on the budget is ideal. And obviously there's great impact that this has on public, and we understand that. But from an administrative perspective, trying to deal with our structural issues in the budget is paramount.
Okay, so I guess politically it might be easier to spend a little bit less money, but infrastructure-wise and just getting things done and getting ourselves out of that deficit financially, it's probably best to just rip off that Band-Aid and go forward. Is that what I'm hearing in other words?
We all love dog parks and we all love a zero budget. So I think
you're really good at this, Mr. Robar. Yeah, you got me. Yeah, it's true. Okay, so and one thing we know is that, and we've always known this, as the city grows, as we get more densification, as we get a higher population, we need to also provide more services. That's just a fact of city growth. So, I guess the question I have is, this doesn't get us there if what we sent to council is recommendation for an unfunded service package. If we move to raise these fees, but it's not with a funded service package, then all we're doing is raising fees and we're not getting the results we need. Is that sort of the understanding of administration as well?
I think that depends on the direction of council. So I think if direction of council is continue to maintain a variance in this file and have this money allocated specifically to growth in these, or permanency of off-leash dog parks, or we pick a few or something like that. I mean, that's always up to council. So I think, our preference has been kind of laid out, but certainly you have the option to do whatever you wish.
Okay, so best practices financially, can we say that? financially, best practices are to take care of variances because you know the long-term savings just are not there. You get long-term costs that way.
I would agree.
Yeah. Okay. All right. I think that sums it up. I'm not excited about raising licensing fees. I wish that maybe the $8 number wasn't there and the rest could be handled through appropriate taxation. But see what everyone else has to say on that. Thanks.
Thank you. Councillor Rutherford, please go ahead.
Oh, sorry, you can, I was anticipating Councillor Knack putting a motion on the floor and then having questions on the motion.
All right.
Apologize.
No problem. How about we go to Councillor Knack next? Please go ahead.
Sure.
Councillor.
Yeah. And appreciating Councillor Paquette's questions, I didn't have a point 2 about the remaining half, if you will. So that might need to be an amendment. I can't draft it on the fly. So I'll start with what I've drafted. And maybe recognizing the other piece. So the motion would be that an $8 per year increase to dog license fees for both spayed, neutered, and non-spayed, neutered animals, and that the funding be used to create and enhance off-leash dog parks across Edmonton, as well as to address the financial deficit for this program. And then I'll introduce when appropriate.
Yes, please go ahead.
Thank you. Yeah. So as sort of noted, I think this amount in itself wouldn't actually address the entire deficit. I actually think Councillor Paquette's last round of questions might suggest we should probably have a point 2 that comes to SOBA, but appreciate we've got a million other priorities, and that's a separate conversation. But I still think reasonably that makes sense from a governance perspective. It probably makes sense to have a point 2. So I'll defer to maybe Councillor Paquette to make that as a what I would probably consider a friendly amendment. But just to this, you know, this is a bit of a little bit of picking a number randomly, but also recognizing this would cover about half of what we're looking at, assuming we don't see a drop in registrations. And what I've heard is that we have more enforcement officers than before to try to stay on top of that. I think that to ask for it to be covered entirely by a pet license fee or entirely by tax levy is also probably not a reasonable approach. I think there is a value on both being a role in this. There's something we need to make up, but I also think there's a stronger community benefit. I'll speak to that a little more in closing about the broader community benefit. But I think we need to do something because, again, right now, the original recommendation on this report was to receive for information. And if we did that, we would essentially just be saying, yep, we're going to continue to have an $800,000 deficit and we won't build any, we won't continue on what was an incredibly popular program. So to me, receiving for information makes no sense at all because it doesn't help in either of those situations. This begins to let us move down a path. I've left it fairly open-ended. I would want the team to be the ones to decide how you would distribute that money. You might start making some permanent, some might be temporary to start, and then over time, as that continues on, you might do more and more permanent. But for us to get into the weeds and tell you exactly how many parks you should create with that money, I don't think is the right idea either. But we need to give clear direction that this is what we want you to do with some of that funding as well as addressing the deficit. Thank you. Happy to take questions.
Thank you, Councillor Knack. Councillor Paquette.
Oh, thank you. Okay. I don't want to bump Councillor Rutherford, but okay. So
yes, sorry, just because you're on the committee.
I'll just if Councillor Rutherford can go first, that'd be great.
Okay, sure. Councillor Rutherford, go ahead.
Sorry, we're making it difficult for you, Madam Chair, today. I apologize. I guess my first question is to Harm. We discussed increases in fees in the 4-year budget debate, correct?
Yeah, thinking back, I think we probably did.
I know, and I'm kind of fuzzy on it too. Do you remember? Because I feel like we did debate, and maybe Mr. Robar, you remember, or Mr. McEwen. I feel like we did debate the pet licensing fee, and at that point, there wasn't a political appetite for it. Is this ringing a bell to anybody, or am I making up stories at this point?
Yes, I recall that conversation, Councillor. We did discuss it. We did share some of the benchmark data from the jurisdictional scan, and a decision was made at that time not to increase them.
And yeah, okay, then I'm not. And then we had decided at that point to increase. We funded the service package. We funded a few service packages. There was one around dogs and open spaces, and then the animal care and control in that 4-year budget. Correct?
Yeah, that's correct, Council. I'm just pulling it up right here. So there was a service package approved for animal care and pest management, animal welfare, enforcement activities. Yeah.
Yep. Okay. So we debated increasing a fee. Can you maybe, John, then can you speak to some of the information in the jurisdictional scan that influenced our deciding not to increase the fees at that point? And
yes,
or if it recommended, if we do increase, what those numbers should be?
We didn't actually establish what those numbers would be, so we don't have research around that. However, I would share that we are currently engaged in our animal licensing and control bylaw renewal project. We finished phase 1 of public engagement. We're currently starting phase 2. And the results of that, along with a draft bylaw that addresses all fees, will be coming back to council in early 2025. But to answer your first question, Councillor, I can give a brief summary of what it looks like in Alberta. So currently in Alberta, the license fee for an unspayed or neutered dog is $77 in Edmonton, $70 in Calgary, $77.60 in Red Deer, and either $45 or $50 in Lethbridge, depending on permanent ID. For spayed and neutered animals, in Edmonton, the cost for a dog is $37. In Calgary, it's $44. In Red Deer, it's $36.15. And in Lethbridge, it's $20 or $25, once again, depending upon permanent ID. So currently, sorry.
No, go ahead, sorry.
I was just going to say, so currently, for unspayed or neutered animals, Edmonton has the highest rate, except for Red Deer, that is 60 cents higher. And for a spayed and neutered animal, we are more expensive than Red Deer and Lethbridge, but we're $7 less than Calgary.
Okay, and you mentioned something before about not wanting to unintentionally create a disincentive. Can you walk me through that a little bit further, what you meant by that? I think it was around the neutering or the spaying.
Yeah, some people choose not to license their pets for a variety of reasons, whether it's financial hardship or they don't believe there will be any consequences, whatever those justifications might be. So when those pets that are unlicensed come into the Animal Care and Control Center, our ability to trace the ownership of those animals and then successfully reunite them with their owners is much more challenging and often unsuccessful. One of the reasons for that is people know that when they come to the Animal Care and Control Center, there is a chance that they might be ticketed or be required to license their pet and pay the fees that are owed for the kenneling of that animal. So we do waive those fees when it's appropriate. However, that is a financial disincentive for people to actually come and collect their animal. When we seize animals and then provide care for them at the Animal Care and Control Center, there is a significant cost to us to do that. And so recovering those costs is one mechanism that we can hold pet owners accountable. But we do see that licensing, especially licensing that increases, can have a depressing effect on our licensing rates, which, as we've discussed earlier today, have been dropping for the past 5 years.
Okay, thank you.
Thank you. Councillor Paquette?
Yes, thank you. Yeah, I'd like to amend the motion to add a part 2. And I hope the wording works. If not, we can get some advice on that. But number 2, that administration return to SOBA with a funded service package to make the variance whole regarding the funding drop-off. And I'm sure that text will show up in chat at some point as well. I can throw it in myself.
Thank you, Councillor Paquette. Did you want to speak to the amendment?
No.
All right.
I think it speaks for itself.
Okay, and Councillor Knack and committee, do we see this as a friendly amendment? And I'll ask City Clerk as well. Is this considered a friendly amendment?
This looks like an addition to the original one, and I'll revert to the committee to decide if it's a friendly amendment.
Okay. Councillor Knack?
Yeah, I'm fine with it.
Okay, great. Let's add it in.
Can I just speak to that quickly?
Please, yeah, please go ahead.
Just the funded versus unfunded. I think, you know, I wouldn't be channeling my inner Stacy if I didn't say, if you want this to go as a funded service package, that means it's the most important thing you're dealing with the budget. It means that that's where the money is going to go to right away. Versus unfunded, you can stack it up against your other priorities and have that conversation. So my suggestion would be to go unfunded. But again, it's up to council.
I would like to thank you for pointing that out, because that has been the direction that administration has given us recently, that any package that we bring forward at this point be unfunded for us to discuss and consider at the spring SOBA. So I would request, Councillor Paquette, that you might make an amendment to add it to be an unfunded package.
I can restate it. I was this close, Madam Chair. It was this close. I almost had it in there. Thanks, Mr. Robar. But yeah, Mr. Robar makes a good point. My only concern with that, Madam Chair, is that if we do not show a commitment to this, then it makes no sense to raise dog license fees at all, because we'll be putting in a half effort for half results, which will not go unnoticed by the public in their experience. So that was why I suggested funded, but based on advice from officials, I will reword the motion without reading the whole thing in. If I can, just change funded to unfunded, and that I'll restate the amendment at that point, with that point.
Okay, great, thank you. So now we have a complete motion on the floor. Yes?
And so with that, I would like to introduce.
Please, go ahead.
Okay, so now that we've got it as an unfunded service package, I would say that it's really important to have this part two, because part one doesn't get us there. But with part one, if it passes, that will increase the cost for folks. If without part two, this effort doesn't actually make a lot of sense. And so I am a little bit leery of keeping it unfunded. I understand completely where administration is coming from. But sometimes I think that we've had the experience in the past where we've had a number of unfunded service packages come to council that are things that council actually cares about, but get sacrificed on the altar of low tax rate, which is good. We should always be striving for low taxes. But at some point, low taxes and service levels, reach a breaking point. And I'm worried that that's what happens. And when people go to experience their city, there isn't the commitment from council to give people a good experience of their city. So I'll just leave it at that as my introduction. Thank you, Madam Chair.
Thank you, Councillor Paquette. Councillor Rice?
I think Councillor Rice does not have the first round yet.
I think she asked for her name to be removed. Is that right, Councillor Wright?
Well, since it hasn't been removed, I will just ask, but as Mr. Robar mentioned about channeling Stacy, do we not have to, if it's a funded service package, do we not have to also have a source stated?
Tax levy.
I'll let Harm do that.
Yep, if it's an unfunded service package, it comes forward with the funding source essentially is the net requirement for the service package, which would by default be tax levy unless we're told otherwise.
Okay, so I agree then. I think it's better just to come as unfunded. Okay, thank you. And sorry for my dog barking in the background. Don't know if you heard him.
No problem. Is he licensed? No, just Councillor Rice, please go ahead.
Yes, he is.
Thank you. Thank you for my colleagues to put the motion on this. This is demonstrate our commitment and effort. And we really want to provide this commitment and to the community and for the better quality of life. So my question to administration, and also I want to thank you, Mr. Robert, and the team mentioned that, and because that is my question when I first saw the motion. So because in the report we talk about for this program, we could provide in these 3 different way, city-led and developer-led and then community-led. And so my question is, in terms of the cost for the spending for the program, and those 3 different type of way to deliver this program will be the same cost, or you will come back with analysis for the different cost?
Yep. Toss that one to Craig.
Yeah, just to make sure I understand the question. The question is regarding the different ways that the city can deliver off-leash dog parks. Are you asking if we would take this motion and then come back with a report?
Yes, and then with the different cost for the different way, or the same cost for the different way. And then I know to me this is a little bit confused, because if we are going to deliver the program in the different ways, and the developer-led and city-led, community-led, that will be totally different. And then I don't know how different it could be, because we're not in that detailed discussion yet. But I just want, from financial consideration perspective, will you come with the option and for your report?
I don't interpret the motion to say that we would come back with a report before proceeding. I think we would have to work internally. I think from what I heard from Councillor Knack, the intent would be to use this increase and to look for the most cost-effective way to deliver the program, as we would decide. That's how I'm interpreting it, but it might be a better question to answer.
Okay, so then your interpretation tells me that means you are going to plan the program and based on what revenue we will have based on this increase phase. Is that proper understanding?
Yeah, looking at the motion and looking at how much would potentially, I think we would first work with our community services partners to better understand what we believe the increase in revenue would be, and then take a conservative estimate in terms of like what we could deliver this year, and then continuously evaluate the program like we do with all of our programs, in order to how do we best deliver the best service for our public. But I don't believe it's descriptive in this motion.
Okay, so the next question is about enforcement financial costs. And then right now we're not discussing that piece at all. And if we're going to continue this program, and then for your report come back in SOBA spring, does that mean we will include in that enforcement cost, like forecasting as well? And because that is a larger, almost like over $300,000.
Councillor, the enforcement costs can be linked to the service that is provided. With no additional enforcement costs, we would simply provide no proactive patrols of the new parks. With the enforcement resources approved, we would be able to provide proactive service. In either case, regardless of the decision, we would provide a response to citizen complaints and provide our typical service where we investigate violations of the bylaw after the fact. The difference here is really whether or not we provide that proactive patrol services. So I think that's really the question when it comes to the resourcing and the funding of the enforcement officers.
So that information, that type of information will be included in the report back to the spring SOBA, right? So I just want to make sure, and because I want to be very clear and upfront, and in terms for this program to be successful, we need to have operational maintenance and public engagement. Also, we need to have the enforcement financial cost as well. So I want that information to be included, and when the report come back, and in the spring so bad.
Thank you, Councillor Rice. Councillor Rutherford?
Yes, sorry, one final round of questions. I hate to shore this up, but we've had a few memos come into council about having to close down intake at the Animal Care and Control Center. So I'm just worried about the perception of increasing these fees and then still having those kind of closures. Can somebody speak to that? Because I really am, I understand the intention behind this, but I'm worried about the creating the motion, how it's worded around create and enhance off-leash dog parks and focusing specifically on off-leash dog parks and both the creation and the enhancement, as opposed to all of the other factors that we need to consider in animal care and control with that pet licensing fee increase. That's what I'm struggling with. So, and I know, like, already I've had residents say, I pay a pet license fee and then my dog couldn't even, you know, he got lost and they couldn't even bring him in. I've had residents say that. So I'm really concerned about this increase of fee and that perception of service on the animal care and control side. John?
And I would leave that probably to John. But my suggestion would be the way that this motion is worded, we invest that in the dog park world.
Yeah, that's how I read it too, but I'm concerned that it's not looking at the big picture of like, what are the pressures that animal care and control is under, that multiple, like the dog license fees doesn't just go to off-leash dog parks. The dog license fees go to a multitude of things, correct?
That is correct.
So the way that this motion is worded right now is we're going to increase people's fees by $8, be it neutered or unneutered dogs. And we're going to put that specifically to enhancing and creating new off-leash dog parks.
That is correct.
And also addressing the financial deficit.
If I can just clarify one thing. So increases in fees go towards funding the program. And if the next priority in funding this animal welfare program is off-leash dog parks, then that, like, I mean, that would be the next thing that's funded.
But but we're not making that, like, the thing that I'm struggling with here, and I haven't even let John have an answer to this. The thing I'm struggling with is you're asking me to make a decision on this motion about if this is a priority. I don't know what the other pressures and concerns and ways that we would spend that money if we did increase that fee. And to say that, yes, off-leash dog park rises to the top of that. So John, can you help me get a bigger holistic picture?
Yeah,
so if we increase the fee by $8, what other things could we use that money for in some of the animal care and control space?
Speaking from my limited perspective, Councillor, I would have to say that if we were having a discussion about priorities when it comes to animal welfare, I would suggest that increasing capacity at the Animal Care and Control Center and through our community programs would be my first priority when it comes to how to spend additional funding. The reason for that is, as you pointed out, twice now in the last 9 months or so, for the first time in 30 years, we have had to suspend the intake of healthy, lost and stray dogs, which is something we've never done before. And the reason for that is simply reaching capacity limits. And the whole of the animal welfare system, all of our partners, such as the Edmonton Humane Society and other animal rescue organizations, are also overwhelmed and at capacity and have been since the pandemic resulted in the pandemic pets phenomenon. So to answer your question
we also
quickly, I would say
added
it's
funding
capacity.
for Humane Society in our service package, recognizing that pressure.
Exactly.
Okay, I'm not on committee. If this comes to council as is, yeah, anyway, I'll speak to it when the time comes.
Thank you, Councillor Rutherford. Any other questions? Okay, so now to speak to the motion on the floor.
You want a motion to extend orders to finish the agenda? So
Oh yeah, that's right. We're almost at 3:30. That's a great idea.
I'll move that.
Thank you. Please vote on extending the orders to finish this item.
We have all the votes.
Please display the vote. And that has carried. Okay, so do we have anyone signed up to speak to this? Great, Councillor Rutherford, please go ahead.
Sorry, I'm not on committee. Do you want?
Yes, you're correct. Councillor Paquette, please go ahead.
Oh, okay. Yeah, I obviously fully support this motion. It's good old-fashioned city work, which is a breath of fresh air. We're not trying to solve the world's problems here. We're just trying to get parks for dogs. So I'm obviously hugely in favor of this. It is core services. Parks are core services, so this falls into that category. And so it makes a lot of sense for us to ensure that we get that right. That was one of the commitments from the mayor and this council, is to focus more resources on what the municipality considers a core service. Now, animal welfare and control, those kinds of things are obviously very important. Obviously a provincial responsibility that was downloaded onto municipalities. We picked up the slack when the province stopped funding it. And if we want to continue to fund those things or increase funding, we can certainly choose to do that as well. But I do feel that those are two separate conversations. One is, how do we address responsibility that wasn't ours to begin with? The other is, how do we address responsibility that is very much ours? And I think that this motion speaks to that. I am not a huge fan of the $8 per year increase to dog license fees. I've communicated that with Councillor Knack, but we can't have it all. And so rather than it increasing to $16 or $20 a year, in addition, this is the happy medium where dog owners are asked to pay about half, and then the rest of the city would pay about half in order to make all of this whole. So with that math, that makes a lot of sense. You got the user fee as well as the general good encapsulated in this motion. So I would hope that committee supports this, and then when it goes to council, they get supported there as well. Thank you, Madam Chair.
Thank you, Councillor Paquette. Councillor Rice.
Thank you, Chair Principe. I do appreciate the motion put on the floor, and then because from today's conversation, we heard, at least for myself as a councillor, first-term councillor, I heard, and we do have the problem exist and from past few years and from carrying on and for the deficit as well. I think instead of we keep the problem unsolved, I think this motion on the floor maybe not perfect, and for some pieces, and maybe have more discussion could happen. However, give us moving forwards to looking for the solution and how we find the proper solution to really address some problems that already exist for a while. That is one thing I think this motion could support us to take steps by steps to move forward. The second, I would like to say, and the reports actually really, the reports come back for this 7.2. It's really impressive because there are so many, the 8 attachments. There's so many work, and for this great work, I do not want to say this great work be lost. And if we already started doing this much work to looking for the solution and to resolve the deficit issue, to resolve the costing issue, and to really find a solution that community actually needed. And then because last year, 2023's pilot project improved, and even for myself as a representative for the South Edmonton area, I heard many positive feedback. Even last week, like 2 days ago, when I was walking in one neighborhood, and then the person was walking his dog and talked to me, and how much challenge in the wintertime, and for him, even driving long time to go to different neighborhoods and to walk his dog. I think this pop-up dog program, and is really actually is needed and for our communities. So I would like to support our council moving forward to really identify some effective solution to address those financial deficit, also to address the community needs. So I'm going to support this motion recommended to the City Council. And then I'm looking forward to hear more of my colleagues and from their perspective, how we can address this as a policymaker and to really make sure our community's needs be met. Thank you.
Thank you, Councillor Rice. Councillor Rutherford.
Yeah, okay. Where to begin? I understand what we're trying to do with this motion, and I understand how nice it is. I'm not an I have 2 dogs. I love dogs. I love dog parks. I love going to dog parks. So I don't want to come off as the anti-dog park counselor. And I'm very concerned about multiple points of this motion. First and foremost, we've pulled the number $8 as an arbitrary number without any kind of understanding from even a business perspective of what that fee increase would do to motivation for people to sign up. If we're actually going to get the revenue that we would want to see from that, let alone all of the feedback that I'm getting from a lower income ward that I represent about how everybody is already at the brink. And it's one thing if we're increasing the fees to pay for things that are essential, but this has already been identified as non-core in our OP12 work. When I read create and enhance off-leash dog parks, that is not something I can turn around and in good faith with people that are barely making their bills say, yeah, it's increasing that much, but your dog license fee is increasing that much, but you don't actually get any new dog parks because there's none actually in the ward. And even if you did, we have, I think about, I withdrew the assisted snow clearing motion. We have unfunded the turf maintenance and horticulture, and there's so many other things. And then we get told, I get told this council's out of touch. And I don't like that. I hate that narrative, but these kind of motions don't help it. They really, really don't. And I don't mean that in a disrespect. I enjoy working with all my councilors, and I understand the intent of this motion, but I do think it will come off that way. It'll at least come off that way for the residents that I represent. So that's why I also struggle with point 2, because like I said, if this was coming as unfunded, it's the same argument I made when we had the pop-up dog park debate previously as well. It's creating expectations, and that we then deliver on those expectations. And as I mentioned, there's things that I think we are not doing well that we need to be focused on doing better first before any enhancements and creating new. I even think about Lauderdale Dog Park and how it's not accessible. There's no pathway for people in a wheelchair to get through to Lauderdale Dog Park right now. There's no public permanent washroom facilities. There's issues we have, whether you agree if it's provincial downloading or not. The reality is we are responsible right now for animal care and control, and increasing this fee and then having any further closures of that facility is very, very concerning to me. So I agree in principle with with the idea of have identified 800,000 that we're sort of short in this area. We need to rectify that. I have no problem. I don't think that this is how we do it though. I think that we have a comprehensive conversation about fee increases when that bylaw comes back, and the bylaw work might also do other things that would help with that. I think we look at, for example, some of the other OP12 reallocations. I think about in my ward, there's 60,000 that we are no longer shoveling sidewalks. Is that better prioritized towards this, if that's really important to council, covering up this deficit? But I've already said that with OP12. So I understand the intent of this, and I'm sure Councillor Knack is going to make some really amazing arguments that, which is why I love municipal politics, because we can have such respect for each other and then vehemently disagree at the same time. But if this comes to council, I absolutely will pull it. I absolutely will vote no, and I absolutely will likely have some amendments for it as well. So I do want to say that. Thank you.
Thank you, Councillor Rutherford. Councillor Knack to close.
Thank you, Councillor Principe. No, and I appreciate that. And we'll see if I make any compelling arguments, but I'll offer a few thoughts. So what we heard today is that if we receive this report for information, we're essentially accepting that we would continue to operate with an $800,000 deficit. I haven't heard anyone say that's the right approach. So the idea behind this is to start addressing what is a gap right now. We have a financial deficit, and we also have a program that was extremely popular. And as I thought about this more and more, originally my hope was just to do a fee increase to address the cost of introducing these parks, but that was prior to the whole conversation we had around the deficit. So I think it's good governance for us to address the whole deficit. And I would say, and I appreciate that fear of being, that concern that's being raised about being out of touch, but I think for me, it would be out of touch to not address the deficit. And when I look at the success of this program, it's something that really doesn't cost a lot in the grand scheme of things. If you go back with me into the way back machine and you go to the 2015 to 2018 capital budget, as well as the 2019 to 2022 capital budget, we had capital profiles for just the top two locations for off-leash dog parks, one in Southeast Edmonton and one in Northwest Edmonton. In both of those capital budgets, those parks would have cost about $300,000 each. Never did we fund those because that was a really large amount of money for a single park. So this is where I want to give a shout out to the city staff who did a phenomenal job of saying, hey, you know what, we keep bringing forward these packages, council doesn't fund them. What's a different way we can go about doing this? So for essentially the same cost as one park, they were able to create 19 parks across the city. And yeah, they didn't all look perfect. They weren't every location wasn't ideal. We had feedback, but more often than not, what we heard is what we heard from the speakers earlier today, which is that these are locations closer to home where people can gather, like you would a playground in a community, like you would in other types of amenities. This is just a different type of amenity for folks who maybe haven't needed to go access a playground. Maybe you're a family with a pet without any kids. In a lot of cases, you've been required to leave your community to go get that access to recreation, to go have that opportunity to connect with others. Here's a place where you can connect with people closer to home. That helps build just that sense of community, but it also helps build safety. So for me, this is actually one of those things that when I put out the call to folks that I represent, we had some conversations over the weekend on both my Facebook page and a number of Facebook groups. People were very supportive of seeing this program continue. I think they would have liked to not have an $8 fee, probably would have preferred a $3 fee, but if we're going to go out to people and talk about what this money will actually do, which is that it will allow for the continuation of many of these parks, ideally maybe even turning some of them permanent over time. We'll let our city admin use the funding as they best see fit. But I think this is something that is one of those easy things to support because it had provided such great value across the board. So for me, why I wanted to bring this forward, I bring this forward as someone who doesn't have a pet. That's not I don't dislike pets, but I just, pets aren't my thing. But I also know how big it is for folks and how many gaps existed across the city. And if we don't do this, we're just never going to do them, right? Because we're not funding them through the capital budget as standalones. While the community-led ones are nice, only a handful of communities have some of that amenity space, like a rink where they can do that. And the developer-led ones, we've heard from the developers, they would want to do more, but there were challenges as they were trying to do some of them. And so it hasn't been really easy for them to implement that in the way that I think we all hoped that they would. And so if we want to have that gathering spot, if we want to have that place where people can come together with their dogs, this is one way to do it. And I think it makes sense to split it between fees and the tax levy. because there is a broader community benefit. Even though I will never use one of these locations myself, I can see how this will help as a whole build a stronger city, build a more connected place. And so I think with the population growth that we're seeing, with the number of people that own pets, which is typically around 50% citywide, this is filling a pretty important gap. And I do think parks fall within that core service for me. And so I would encourage folks to support this so that we can continue on with a program that was really popular last year. Thanks to CityMin for that great work to helping make this a reality. So I'll encourage everyone to support it. Thank you.
Thank you, Councillor Knack. I'll ask my committee colleagues to please vote now.
We have all the vote.
Please display the vote. And that has carried. All right, we are completed item 7.2. Responses to council inquiries, none. Private reports, none. Motions pending, none. Notices of motion and motions without customary notice. I am not hearing anything. That means we are adjourned. Thank you very much, everyone.